Well, good morning. I'm calling to order. Hello, I'm calling to order.
Good morning.
Good morning. Good afternoon. My goodness gracious. I find that these evening hearings do kind of change tone a little bit. It gets a little looser, including the chair mistaking what time of day it is. Good evening. It's not even good afternoon, which I had said. Good evening, all, and welcome to the House Committee on Children, Families, Finance, and Policy. I'm calling the meeting to order. And welcome. A reminder to those watching at home that we have a committee website where you'll find a lot of materials for the meeting. We're going to start, as we usually do, by having the clerk take the roll.
Chair Pinto.
Present.
Vice Chair Keeler.
Present.
Lee Daniels.
Present.
Representative Bliss.
Present.
Representative Coulter.
Present.
Representative Davis. Representative Hanson. Representative Hemmingson Yeager.
She's in another committee, so excused.
Representative Hicks.
Present.
Representative Hudson. Representative Kotyza-Witthuhn.
Present.
Representative Lee.
Present.
Representative Nelson.
Present.
Representative Perez-Vega.
Present.
Representative Zalesnikar.
Present.
We have a quorum.
We have a quorum. Excellent. And I know the vice chair was not here at the last meeting, so I'll just ask if somebody could move approval of the minutes for the March 7th meeting.
So moved.
That was Representative Hanson, I believe. And so any additions or corrections, members, to those minutes? Hearing none, all in favor of approval of our March 7th minutes, please say aye. Aye. Any opposed? Okay. Motion passes. Thank you, Representative Hanson, and the minutes are approved. So we've got a bunch of bills on the agenda today, members, and I'm going to ask both bill presenters and testifiers to keep things fairly tight if they can. I think Ms. Colburn, our CA, has kind of made requests regarding time limits for folks. We're going to start with Chair Fischer's bill, House File 2225. I'll ask Vice Chair Keeler if she's willing to move House File 2225 to bring that before the committee.
Yes, Chair, I move House File 2225 be moved before us.
And Chair Fischer, you've got the A1 amendment, and you wish to have that be moved?
Yes, I would like that moved, please.
Okay, and any comments on what that is, Chair Fischer?
What it is, it's technical assistance from the Department of Human Services to make sure that we've got everything that will fit into their framework.
Okay, great. Vice Chair Keeler, you're willing to move the A1 amendment?
Yes, I move the A1 amendment.
Okay, any comments, discussion into that motion, members? So the A1 amendment is before us. All in favor of approval of that amendment, please say aye.
Aye.
Aye. Any opposed? Okay, that motion passes. Thank you. Representative Fischer, your bill is amended, and please present it to us.
Thank you, Chair Pinto and Committee, for the opportunity to present House File 2225. And I'd also like to thank, this is a good bipartisan bill. I also like to thank my co-authors, Keel, Knorr, and Baker, who are also on the bill. This bill is a proposal to provide prepared meals statewide to those experiencing food insecurity and who lack the resources or the ability to cook for themselves. Meals would be targeted to our neighbors not eligible for other federally funded meal programs and tailored to the cultural and dietary needs of Minnesotans being served. The funding proposed in House File 2225 would allow eligible grantees to work with community partners to bring nutritionally balanced meals customized to the communities they serve. Grantees will prioritize ingredients that are rescued or donated from the food banking network, as well as locally produced or processed ingredients to maximize state dollars and support Minnesota's agriculture industry. The funding in House File 2225 is estimated to provide over 750,000 meals each year for Minnesotans. At this point in time, I'd like to turn it over to my testifiers.
Excellent. Thanks. Thank you so much. We'll invite those folks to come up. Thank you, Chair Fischer. And once you get settled in, if you can just identify yourself, please. Share your preferred pronouns if you're comfortable with that, and proceed with your testimony.
Chair Pinto and members of the committee, my name is Robin Manthe, she, her, and I'm the Managing Director of Kitchen Coalition, a program of Second Harvest Heartland. I'm here to testify in support of the House File 2225 to create an ongoing grant fund that would support the distribution of prepared meals to communities in need in Minnesota. Many of you know Second Harvest Heartland through our work as a food bank, but since 2020, we have been working with kitchen partners across the state to create nutritionally balanced, culturally connected meals. Our research shows that 15% of those who are food insecure don't have the home, health, or ability to cook for themselves. And even with existing programs, many aren't getting the prepared meals that they need. Born out of the pandemic, Kitchen Coalition is now a permanent program of Second Harvest. We work with 16 restaurants and caterers, over 50% of them BIPOC owned, who turn donated and locally sourced ingredients into freshly prepared meals. and 75 nonprofit organizations help us get those two folks on a predictable schedule. Last year, we provided nearly 1.4 million meals and invested more than $6 million in local communities. We're working with Lutheran Social Services to request these state funds to support this work because we've seen success in bringing this model statewide. In early 2022, we received $3 million in American Rescue Plan Act funds through the Minnesota Department of Agriculture, which we used to administer a prepared meals grant. This funding supported the distribution of over 488,000 meals in the first 9 months of the grant period. People who received these meals are not served by existing state and federal meal programs, but still face barriers to cooking. Our CEO, Allison O'Toole, often says that if we can't keep people fed, we can't do much else right. Today was Hunger Day on the Hill, so I'm sure many of you heard from constituents about the need for broad investments and solutions to fight hunger. And we hope that you'll consider this proposal as part of that robust package on food security. Thank you.
Thank you so much. And our next testifier, come on up. And as you get settled in, we'll just ask you to identify yourself, share preferred pronouns if you're comfortable, and proceed with your testimony.
Chair Pinto, members of the committee, my name is Lisa Gilland, and I'm the Director of Operations of Meals at Lutheran Social Service of Minnesota. I oversee operations of our nutrition programs across the state. It's my honor to share with you today what the passing of HF 2225 will mean to our fellow Minnesotans. For 50 years, LSS Meals has provided meals wherever there has been an ask. In 2022, from War Road to Marshall, Mankato to North Minneapolis, LSS Meals prepared, packaged, and delivered 1.55 million meals through dining programs, youth organization contracts, and what I'm here to speak with you about this evening, prepared meal distributions. Distributions take place statewide at food shelves, local places of worship, or community centers with volumes ranging from 300 to 1,000 meals. Meals are often handed out within 5 minutes, and individuals are often turned away because the demand is so strong. These distributions not only provide relief financially, but offer one of the most basic needs we don't often speak of, hunger and the need of nutrition. I would like to take a moment to share a few stories of how this community meal distributions have made a difference in the lives of others. A college student in Thief River Falls explained that even though he works and goes to school full-time, he doesn't have enough to make ends meet. He said these meals have meant that he could at least have one meal a day, knowing where it's coming from, versus no meal that day at all. In Worthington, a mother picks up meals at the distribution for her disabled son. She explained that having these meals available for him not only ensures that he's receiving the right nutrition, but it's also relieving her of caretaking tasks that she has difficulty in completing due to her age and mobility constraints. In December, I took part in a distribution where the LSS Meals team prepared 1,700 meals. Cars lined the streets waiting for 5 blocks. In between these cars, a family walked up to the distribution with a radio flyer wagon to transport meals home. It was very clear they were in need of food. The gratitude they shared with me is something I think of every single day in this mission of service. Thank you for your time.
Thank you for your testimony and for your work. Then finally, there's a third testifier signed up. Great. Please identify yourself once you get a chance to settle in and proceed.
Chairman Pinto and the committee. My name is Trung Pham. I'm the owner of Pham Rice Bowl. I have been in partnership with Second Harvest Heartland now for the last 2 years in preparing the meals for the community. Every Thursday morning, I reserve the day to deliver the food to our North Minneapolis location, to the Shiloh Temple. And what I'm seeing, the families, the individuals that come out to get these meals, they're greatly and extremely appreciative of getting these meals. You know, I'm humbled from the fact that there's so many hungers and so many people out there that need these meals. But on the flip side, we're so happy that we're able to provide a solution for these individuals. Food insecurity and hunger doesn't extend, it knows no boundary. It's extending to the colleges and university. Last week when I delivered a catering to the University Aquatic Center, the director there, she mentioned there was a gal has not been eaten for 24 hours. She was the lifeguard and she ended up passing out at the pool. Second Harvest, they do extend their meals out to the colleges and the community. So when I hear of these kind of stories, it just breaks my heart, because at one point I was one of those students that didn't get those meals during the school year. Now, Farms Rice Bowl, we weren't immune during the pandemic. In addition to that, our restaurant located on East Lake. So during the pandemic and the civil unrest, our restaurant struggled. So when we partnered with the Second Harvest Heartland, they're able to reimburse us for some of the labor costs to produce these meals. So that's allowed us to bring back some of our very good employees back to work and keep our doors open. So through Second Harvest Heartland and the funding that go through there, it certainly create a major positive impact within the community, and it's just not to the people who's serving the meals. Thank you so much for your time.
And thank you for your testimony and for your work. Appreciate it. Is there any other member of the public who wishes to testify on the bill? So not seeing any, we're going to move to discussion or questions. Members, any of those things? Looking to see. It's a terrific proposal, Chair Fischer. Lee Daniels, we'll go to you as usual.
Thanks, Chair Pinto. I appreciate that. Appreciate the bill, Representative Fischer. The only question I have is, do we have like a list of who the people that will qualify for the grants? Because I know it wasn't in the bill, but I didn't know if there was a specific people that were going to qualify or how that works.
Chair Fischer.
Chair Pinto, thank you. Representative, when you're saying the people qualified, do you mean the organizations who would be receiving the dollars?
Representative Daniels?
Yes, in subdivision 2, the eligible grantees, that's what I was just asking, if there's a pre-made list or somebody that we know is going to be applying for that, just kind of give it a little background.
Chair Fischer.
Thank you, Chair Pinto and Representative Daniels. Basically, what this is getting at is what we're looking at is probably it's going to be people like Second Harvest. You're probably going to be looking at like Lutheran Social Services, the nonprofits that have been around for years doing this kind of work. So we're making sure that we've got a group that has got a stable track record, who's been doing this, who did it very well during before the pandemic, during the pandemic, and afterwards.
Chair Fischer, I'm guessing there's probably a limited number of organizations
Yes.
kind of have this expertise or history, but Lee Daniels?
That was my really only question. I kind of love the premise of it, and we've got to help these families, and just want to know where the money's going to be going, and make sure we have, like I always say, safeguards on where the money's going. So that was my only question.
And Lee Daniels, did you? It looks like there's one of the testifiers is willing to answer your question, possibly, or is available if you'd like that, or to comment. Up to you, Lee Daniels.
That'd be great.
Okay, please, yeah, take a seat.
Representative Daniels.
Oh, hold on a second. Hold on, wait. Take a seat. Okay, make sure the microphone's coming up to your. And then yes, and then please proceed.
Yes,
Ms.
Representative Daniels, we administered the ARPA grant last year. We ended up awarding to 15 different organizations in order to cover the state. And as mentioned, Second Harvest, Lutheran Social Services, Catholic Charities, as well as some CAC, some other organizations throughout the state that have experience providing prepared meals. But there were over 15 that were awarded and more that applied. So there's qualified meal producers. Many of them are already making other types of state meals, like Older Americans Act meals.
Thank you. Lee Daniels, anything further?
Thank you so much for that. And then is it possible you could email me a list or get us the committee a list?
Yes, Ms. Nanthi, if you could send that to the committee or get it to Ms. Colburn, and we'll make sure we get it out to everybody.
Great.
Yeah, good. Thank you. Thank you for answering the question. Thanks for the questions, Lee Daniels. And Chair Fischer, you get the last word.
Thank you, committee, for the opportunity. This is a great bipartisan bill. I ask for your support so that we can make sure that we're helping Minnesotans who don't have food security. Thank you.
Thank you so much, Chair Fischer. And with that, the chair lays over House File 2225 for possible inclusion in a committee budget bill. And again, thank you so much for your work, Chair Fischer, and your leadership. Appreciate you being here. We have Chair Howard to come on up. And if Vice Chair Keeler is willing to move House File 1698 to bring that before the committee.
I move House File 1698 to move before us.
Thank you, Vice Chair Keeler. And Chair Howard, I don't think that, it doesn't look like you have an amendment, and so we can dive right into you presenting your bill. And I think that family, friend, and neighbor care may be something that's somewhat new to some members of the committee. I know this is something we've funded for a couple years now. It's in different forms, so I'll be eager to get some context from members too. Chair Howard, please.
Chair Pinto, members of the committee, I'm thrilled to be here before you today presenting this bill, as you mentioned, an issue that I've been working on for a number of years, and this committee has begun to take a deeper look into, which is how do we support our family, friend, and neighbor childcare providers to help ensure that there's quality care and learning available to all children, regardless of where they get their care or who is their care provider. So what is an FFN provider, a family, friend, and neighbor childcare provider? Well, they are folks that provide and offer legal, unlicensed childcare to thousands of families all across the state. They're the frequent choice of care for parents with infant and toddlers, parents in diverse culture and ethnic communities, and parents working non-standard job hours. And just for some numbers and context, FFNs provide care to more than 240,000 children, nearly 40% of children aged 2 and younger, and 25% of children aged 3 to 5. Members, the high cost of childcare and the shortage of childcare providers, something I'm quite certain this committee has spent a lot of time talking about, means that more and more families are turning to family, friend, and neighbors for care. In addition, many working families of all income levels prefer that their young children are cared for someone they know, trust, or shares their cultural or family values. Over the past few years, a network of community support for FFN providers has been created, providing $4.5 million in one-time funding to build this network of support and get necessary resources to families and communities. These funds are scheduled to expire this year, and this bill would maintain funding for this network and present a path for consistent funding into the future. And so what would these resources be utilized for? A number of things, including helping our FFN providers attain culturally and linguistically appropriate training and resources for health, safety, nutrition, and early learning, resources on early childhood screening, resources to access community-led opportunities, early literacy with a focus on school readiness, a range of resources that aren't readily available for our FN providers through traditional means. And as I mentioned specifically, this bill would create $5 million annually so we can ensure that every child has access to high quality care in Minnesota. Before I'll turn it over to testifiers, I'll just share what brought me to this work is the amazing network of childcare providers in our community, Lored. We'll hear a little bit more about that, but I've seen firsthand the importance of this network in our community and for the families in our community. And it's a group that has shown amazing resiliency and really could use the support and is a model for networks all across the state. And this bill is a way to support and to hopefully expand FFN networks at the benefit of our children all across the state. Thank you, Chair Pinto.
Thank you, Chair Howard. So our first testifier, Julia Pringle, and please identify yourself, share your preferred pronouns if you're comfortable, and proceed.
Thank you, Chair Pinto, members of the committee. My name is Julia Pringle, she, her, and I'm the Minnesota State Director for the National Parents Union, and I'm here to testify in support of House File 1698 on behalf of the family, friend, and neighbors in our network of parents to establish a family, friend, and neighbor child care program. When the legislature decided to dedicate emergency funds to support family, friend, and neighbor providers, you supported 40% of families here in Minnesota who received critical care they needed to support the growth and development of their children. Families with children who have special needs, low-income families, immigrant and refugee families, single parents, parents working non-traditional hours, and families in rural communities have turned to their family, friend, and neighbors to help care for their young children because licensed family care or center care is out of reach financially or geographically. FFN providers are already trusted by the families and communities they serve. The ongoing pandemic, civil unrest, and increased gun violence has disproportionately traumatized BIPOC families. FFN providers are uniquely positioned to help children and families cope with the intensified racial and economic trauma and positively prepare children for a lifetime of learning and development. This grant program allows FFN providers to access culturally appropriate and trauma-informed training to promote safe learning and living environments needed to foster social-emotional learning skills in young children and promote healthy brain development. These training resources also help FFN care providers promote early literacy and other cognitive skills needed to be prepared for school. I believe it is critical to provide quality care and support children regardless of who is providing the care or the setting. Please join me in supporting House File 1698 to help families access culturally appropriate care in our communities. Thank you.
Thank you so much, Ms. Pringle. Thanks for your work. The next testifier, please make your way on up. Thank you. And once you get settled in, ask you to identify yourself, share your preferred pronouns if you're comfortable, and proceed with your testimony.
Mr. Chair and members of the committee, my name is Sue Thomas. I work for United Community Action Partnership, which is serving 9 counties in West Central and Southwest Minnesota. We provide a broad range of services in our agency to families across our region, including but not limited to rental and mortgage assistance, emergency housing, energy assistance, weatherization, rural transportation, food shelves, thrift stores, refugee resettlement, Head Start, and my area is working with supporting childcare and early learning. As an agency, we approach our work holistically so that those we are supporting in our friend, family, neighbor care are aware of the other supports that can assist them and the families that they support to build a stronger community. We work closely across our child care sector to support families, early childhood professionals, and other partners to improve access to high-quality child care and early education for all children. We know that just as a solid foundation is the basis for a building or a home to last through storms and years of use, a solid foundation of consistent care, safe, nurturing, and culturally relevant care is the basis for a child to do well in school and in life. In our communities, there's an incredible shortage of child care providers. As of June 22, First Children's Finance numbers, there were 4,600 spaces in the 18-county Southwest Minnesota region. Very few existing programs serve children who speak a language other than English in their home. Because we work so closely with families, we know that the families are looking for culturally relevant care and often use friend, family, and neighbor child care to meet their needs. We also know that a large number of our families are working non-traditional hours and they rely on friends, families, neighbors, to provide primary care for their children while they work. So even as we work to increase the number of licensed child care providers, a large number of families will still need care during non-traditional hours. Currently across the state, there are approximately, as you heard, 40% of children being cared for in this type of setting. My mouth's getting a little dry. We believe that child care providers, no matter if they work in a licensed center or if they're a legally unlicensed provider, deserve access to the supports needed to provide the highest quality care possible. Those supports can be CPR, first aid, and basic training on safety, nutrition, literacy, and learning activities, parent engagement activities, and referrals to community resources and more. We currently receive funds from DHS through the FFN program to support FFN providers in our community. This grant provides an opportunity for the department to collaborate with us as partners and learn how to best support those FFN providers. Some of our successes have included...
I'll just say we've got a third testifier and
Okay,
have limited time. So
2 seconds. Well, 3. Some of our successes have included offering first aid CPR to dozens of FFN providers, helping assist our first Spanish provider to become licensed, and getting dozens of FFN caregivers training in safe sleep practices. The time is limited, and we would for this funding, and so the supports have helped with this high-quality child care. We're grateful that Minnesota is finally considering how to continue this support for friend, family, and neighbor providers, because this grant has had such a positive impact in our community. Thank you.
Thank you so much. Thank you. And I'll ask the third testifier to make your way up if you are here. Yeah. And then once you get settled in, please identify yourself and proceed.
Hi, Mr. Chair and the committee, or members of the committee. My name is Fabiola Estrada Martinez, and I'm here to support the HF 1698. And also, I'm the co-founder of La Red Latina de Educación Temprana, which means the network of early childhood in Spanish. I have also been a family friend and neighbor child care provider for many years in our community, and I also plan to work in our community raising our children. La Red is a group of Latina leaders that came together in 2013 to make healthy change that benefit children and members of Latino community living in Richfield, Bloomington, and across the state. We have built an effective community driving model, or FFM, support that has potential to be used as a model across the Minnesota. We develop community-driven solutions to support healthy child development and early learning opportunities for children whose families chose or need child care from family members, friends, or neighbors. We do this by providing cultural, early childhood trainings, capacity, and leadership developed for Latino child care, providers to drive the highest quality child care possible to support school readiness. Our work has also changed the lives for FFM providers by changing the understanding of the role from just babysitting to knowing that we work do important job for our children's future and our entire community. We have worked to support other families, friends, and neighbors across the states to help and build capacity and leaders at national level supporting FFM. We currently receive a funding for the states through the FFM grant. This grant program provides a supporting for the states and collaborate with us to partner and alert how to best support FFM providers. However, this grant program is time limited and has been able to fully fund all the work has need across our communities. We need going funding support communities to lead the work. They will impact the health and build for the children. I'm so proud to represent our family, friends, and neighbors, and happy to respond to you any questions maybe you have about FFM providers or La Red.
Thank you so much. Thanks for your work and for your testimony as well. Are there any other members of the public who wish to testify? Okay, and so we can move to those questions or discussion. Members? See Representative Hudson. Yeah.
Thank you, Mr. Chair. I'd appreciate, and it could come from any of the testifiers or from the author, an actual or hypothetical example of how this plays out, because it's interesting as I read over it. I think of my own children and how we made it through early childhood with two boys, and it was because we had the assistance and support and help of my mother-in-law, who stayed home and cared for our boys while both of us were off working. And you know, that you get in this schedule, this tight schedule that you have to keep in order to make it all, to juggle all the balls and make it all work. I never thought of her as an FFN caregiver. We always just called her grandma. And so I'm curious as to an example of how this plays out and how people are connected with these services in the first place, because how would you even know that there's something that you can access?
Chair Howard, start with you.
Yeah. Representative Hudson, it's a good question. And I think I might ask Fabiola to share a little bit about the formation of La Red, which, because it really is a community of folks that sort of came together to help one another, caregivers that, have life experience or maybe a skill in one way to share that skill with another. And by creating that network and that shared knowledge, to be able to sort of support each other. And, our licensed caregivers have a little more easier access to maybe like trainings for CPR or and so what this funding is trying to do is try to bring some of that sort of experience or ability to a non-traditional community-based network of providers to grow that shared knowledge, so that, maybe grandma's able to take a first aid class, that type of thing, and sort of build knowledge. But
Move to Ms. Beltranes, please.
Okay, I have partnered that she's the director, but she's not able to come today. But she saw the way the people was taking care of the children in their own house and the apartments, and they start have problems with those children or with those persons because they don't allow you to have some children in your apartment. And she said, but if you have the classes, if you go into this program, we can have less problems. We can figure out how to manage those problems and how to build all these resources for our community. Also, because we are Latino, most of the people doesn't speak English, We need to figure out to understand everything and figure out how we can create this program that was really hard because we start with zero money. We start with nothing. And for now, we have almost 300 members. Yeah.
And I wonder, Representative Hudson, Ms. Mock may be able to talk with us about, because this area has received funding over the last couple of years. It's been sort of in operation, which may be helpful as well. And I think the idea is to try to continue with ongoing state funding. Maybe Ms. Mock, if that's okay with you, Representative Hudson, Ms. Mock, maybe you can just give us quickly what kind of what the history has been here.
Thank you, Mr. Chair and members. So in 2021, DHS used some of the money it received from the Federal CARES Act. It used about $1 million to give to agencies to support family, friend, and neighbor caregivers. And then later in 2021, the legislature actually allocated another $1.5 million in ARPA funds, federal ARPA funds, for the same thing, for supporting agencies that are going out working with family, friend, and neighbor caregivers.
Okay, so I guess because general, but we'll go back to you, Representative Hudson, and then, yeah.
No, I appreciate the explanation. I mean, it's another example of something that just because of cultural context, I haven't come into contact with, and so getting that briefing on its origins and the purpose it serves is
Yeah,
good.
and also it's not only Latino use these programs, it's everyone use this program. Yeah, and we want to provide those resources to our community, especially to the ladies, because most of them are ladies, but everybody is welcome into our program. Doesn't matter if it's a man or an auntie or a brother or the child, they can have those resources to take care really where those children, where they are at home.
And I might ask, I think there's information from the department about how those grants have worked. I kind of recall receiving a report on that, and perhaps that's something that can be sent to committee members. I'm sort of asking the DHS staff, Chair Howard may have it, or Ms. Mock, but whatever information there is about how that's worked, that'd be helpful for us all to be aware of too. Chair Howard, do you have another comment on that?
Yeah, Chair Pinto, we could get some of the information about how the initial grant dollars have been spent. I don't have I think we did have an initial report on that with me, but we'd be happy to get that to committee members.
Yeah, good. Other questions or comments from Representative Lesnikar? Your head. Yeah, please.
Thank you, Chair Pinto, and thank you, Representative Howard. Yeah, my question was similar to that, is just understanding it. It sounds to me like it's a resource program for the family member.
Yeah, we bring classes. We provide like a CPR classes, checking baby, physical activities, mental health, everything we need for those classes to be like a level of the ladies. They have license. We need to have the same hours or more than these ladies to have. I think it's 40 hours a year for those ladies who work at the child care, who has license, but we want to be at the same level to have all those classes for everyone. Yeah, but we bring resources. For example, during the pandemic, we offer classes by Zoom, but we also changed our pace. We offer free food for all our community. Another organization contact us, and they give you the food, and we provide all this food for all those people in the community. And we have a lot of people coming into the place we are. The place is located at 6500 Nicollet Avenue South, and it's a school. It's called Partnership Academy, and they offer the space. Also, this school is our fiscal agency.
Representative Lesnikar.
No further questions. Thank you.
Okay, good.
Very much.
Davis.
Thank you, Mr. Chair. I too, thank you, Representative Howard, for bringing forth this bill. I too am just trying to understand it. At first, I thought I was hearing, wait a minute, Grandma and Grandpa get paid to watch their children. That's where the confusion was coming in for me. But no, it sounds like Grandma and Grandpa have an opportunity to go get training from an organization. Is that Is that what I'm hearing?
Let's Chair Howard or?
Yeah, sometimes yeah, well, I have grandson and my daughter actually she didn't pay to me, because yeah, it's hard to say, but doesn't matter you are grandma or doesn't matter you are parent, you need to take care of those children, especially when, for example, when my daughter needs my help, I take care of my child, but I don't charge her because it's my grandson. How are you expecting me to charge for?
Ms. Bill Johnson, I'm going to pause you just for a second. I'm going to let Chair Howard sort of decide how he wants to handle this. If you want to, Representative Howard?
Yeah, Representative Davis, thank you. That's a good explanation.
Yeah.
It is to try to those sort of help a network of child care providers build those skills, take those trainings and classes that might not be available to them if not for this network coming together and providing some resources to make sure that our FFN providers have access to them.
Representative Davis.
Yeah, thank you, Mr. Chair. And then Representative Howard, how many networks are there? Are we talking one network or there's multiple networks that this money's going towards?
Yeah, Representative Howard.
Representative Davis, so the $1 million that was applied highlighted a handful. And so an example is CLUES, Comunidades Latinos Unidas en Servicio in St. Paul received grants to help formalize their FFN childcare, kind of get them up and running. But they are sort of across the state, and the resources would help try to create more as well. And I have another testifier that might have a little more of the specifics on data.
Yeah, sure. So, Ms. Luke, if that's, why don't we'll get an answer. Representative Davis, so I can come back to you if you, Representative Davis. Otherwise, it looks like we might have an answer to your question, but I'll let you control that. Okay. So, Ms. LaCroix-DeLune, you want to identify yourself? If either way. Okay, I guess.
Mr. Chair, members of the committee, my name is Laura LaCroix-DeLune, and I'm here representing the Minnesota Prenatal to 3 Coalition. There are 18 grantees currently. 18 grantees currently. And right now it is all expected to end this calendar year because of the one-time funding. And they are networks. I just want to also just clarify, there are networks.
Could I just make sure you speak right in the microphone, please?
There are networks where people will do some outreach and recruitment through libraries, through community education programs. So these networks go into the community. If they see grandparents or others taking care of family members, they will often just do some informal outreach and then help grandmas and grandpas better understand how do they update their information, because we continue to get more and more information about safe sleep and CPR and care. And so we really just want to update people's knowledge through this training.
Representative Davis?
Okay, thank you, Mr. Chair. I just have one more question that's coming to mind. So how many full-time employees, and Representative Howard, maybe you don't know the answer to this, but someone here does. How many full-time employees does it take to oversee this program?
Yeah, Chair Howard.
Chair Pinto, Representative Davis, I believe there's one coordinator at DHS that's overseeing this initiative.
Yeah, Representative Davis, okay. And good, okay, so then going to, something else, okay. Then Lee Daniels, we've got just a minute left here.
Sure, leave me with the last minute, Chair. I'm sorry, just teasing. Very good conversation. I like the idea of the program. I have one little concern or question. Oh, maybe I don't have a question. I forgot everything's different than when I made up my stuff. No, I think we had a good conversation on that, and I don't have much to add.
Okay. Thank you, Lee Daniels. And I will point out the letter from the Minnesota Prenatal 3 Policy Coalition, including kind of highlighting the families that particularly take advantage of FFN care, which I think is good to note. So, Chair Howard, you get the last word.
Chair Pinto, members, I appreciate the questions and the conversation, and want to thank my testifiers as well. This is an important program, and look forward to its place in the conversation that y'all are having in this committee to make sure that every child in Minnesota has access to quality child care. Thank you.
Thank you so much, Chair Howard, and thanks for your leadership on this. Yeah, this is a component of early care and learning that we don't often talk about, but as the letter points out, 40% of infants and toddlers were cared for by family, friend, and neighbor providers, so powerful work. Thank you so much. With that, the chair lays over House File 1698 for possible inclusion in the budget bill. Thank you. And then there we go. So we have Representative Hanson, if you can head on up. Okay, so Representative Hanson moves House File 1198 for re-referral to the Committee on Human Services Finance. And Representative Hanson, there is a A2 amendment, correct?
Correct, and I'd like to move that to get the bill in the shape that I would like. This reflects the ongoing conversations between the wide array of advocates and leaders who've been working on this and conversations with DHS.
Okay, thank you. And so any further discussion to that amendment, members? So all in favor of the A2 amendment, please say aye. Aye. Any opposed? Okay. The amendment is adopted. The bill is in the form you wish, Representative Hanson, so please proceed.
Thank you, Chair, and thank you, members of the committee. Good evening. For many years, we've been talking about the mental health crisis that we're in. We've talked about solutions for the workforce and bed shortages, the inadequate access to care, and the complicated systems and waiver services. This all takes time to address, and we need to be sure that we're equally investing in solutions that provide care directly to people who need it most, especially our kids. Our current system of children's mental health care is really complicated. The best way I've described it to people who haven't navigated this before is that it's kind of like traveling to a bunch of individual islands to get services for your child or your client. And the communication between the islands can be tricky for a whole host of reasons. The specific services needed most certainly exist in our state, but they are often far apart and can only be accessed by venturing across choppy waters to get there. There are many risks of losing someone along the way, and the people seeking this care from island to island do so because they care deeply for the child who needs the help. Whether it be a parent, a school social worker, school psychologist, or any number of important grown-ups in a child's life, navigating the territory of children's mental health takes teamwork, grit, and dedication. We have an opportunity before us to simplify, streamline, and make things easier by building bridges between these islands and the services so more people can more easily access our existing help that's out there. So this bill and this legislation intends to grow a family-centered mental health continuum, and it builds adequate access to care. We know too many children and families in Minnesota are waiting months for needed mental health care or not getting access at all. Without support, too many children have their first experience with a mental health due to a crisis, and many end up needing the highest level of care, hospitalization. We've all heard stories about families languishing in emergency rooms and medical professionals asking us to do more to support these families before they land in the ER. Early intervention matters, and providing access to care earlier is far more effective for the littlest Minnesotans who need it. This proposal is from the Mental Health Legislative Network, and it reflects the top priorities for children's mental health care, with goals to break down barriers to urgently build better access to mental health services. The key points of this legislation include maximizing existing Medicaid benefits to support children and families with services and supports that we have today. These are critically important as we design immediate responses within a landscape that's limited by staff and financial resources. It supports early intervention with timely responses because children do better and when we can prevent and intervene early. It builds on what's proven to work for children and families, focuses on family supports to honor family voices and the needs to support the child and enhance the skills and abilities of the family to help the child through treatment and to achieve well-being in the community. It helps us to make sure that we're sustaining and building a family-centered continuum by building services that must center on the greatest needs of children and families. This proposal exemplifies our opportunity to develop service designs that are what families want and need for their kids. I'm really grateful for the work of the Mental Health Legislative Network. And I don't just say that because this is a bill that is going through a lot of committees and it's got a lot of pages and it's the heaviest in your packet today. I say this because this is the kind of work that makes Minnesota a better place to live, work, and raise a family. Members, this is the kind of policy that has the power to revolutionize the way that we provide critical care to the littlest Minnesotans. And as a mom, there is no higher priority than ensuring that our little ones are cared for like our own. It's always the right time to do right by our kids. So I thank you for your time today for supporting this important work. I do want to make a comment that there are a few sections of the bill, particularly in sections 24 and 25, that are still in conversations between stakeholders and DHS, and there are smooth sailing, to continue my analogy of the islands. And so that work will continue, and we'll continue to talk about that in finance. And with that, I'll turn it over to my testifier.
Thank you so much, Representative Hanson. I should note before we move to your testifier just that the portions of this bill that are in our committee's jurisdiction relate to child care and child protection. So, of course, we're going to understand the bill broadly, but I will want to focus debate and discussion on that, and Ms. Abdul-Holden, just to remind you of that as well. But please identify yourself and proceed.
Thank you, Mr. Chairman. Members, Sue Abderholden, Executive Director of NAMI Minnesota and co-chair of the Mental Health Legislative Network. And I will keep my testimony to those two sections. So the first one is really about MFIP child-only families. So this is where the parent is on Social Security, considered disabled, and so the child is the only one on MFIP. The problem is that if you are on Social Security and it's part of MFIP child only, that parent does not have a work requirement, which makes sense because they're disabled. The problem is if the parent has a mental illness and needs treatment, for example, day treatment or intensive outpatient treatment, and they have no family or trusted adults, other trusted adults, they have to choose between putting their child in, frankly, an unsafe situation or going to treatment. And I mean, you just can't do both, right? So what we wanted to make sure is that that parent could actually get 20 hours of childcare per week based on the recommendation of a mental health professional. They could also, if they're just not doing well, we want to make sure that a parent is responding consistently to that child. And sometimes with some of the symptoms of a serious mental illness, they can't. And so again, we would want that child to be in childcare to get that kind of consistent response, which is important to child development. The second section of the bill, which we are still working on with the Department of Human Services, is really an issue that I have been greatly concerned about the last couple of years. So you've heard about children boarding in the emergency room, and parents will go and say, I can't take my child home. I can't keep them safe. I don't have the services available. There is no other option. They can't get into a psychiatric residential treatment facility or some other type of residential facility, and they're told that you need to take your child home. The problem is that when they say no, they get referred to child protection. And this is not a case of the parent neglecting the child. This is a case of our society neglecting the child, and they should not be referred to child protection. There are difficulties with the language, and so we are continuing to work with the department, but I honestly do not want to ever receive one of those phone calls again from a parent who is being charged with neglect. And I'd be happy to answer any questions.
Thank you so much. Thanks for the testimony and then for your longtime leadership and really important work. Are there any other members of the public who wish to testify on House File 1198? Looks like we do have somebody. And I'm going to ask you to keep your remarks to just 90 seconds, please, given how tight our agenda is. But you're welcome here, and please identify yourself and then proceed.
My name is Wendy Wall. I'm a registered nurse of over 20 years, and I work in Thief River Falls Emergency Department. I also serve on the mental health work group for the Minnesota Nurses Association. Thank you, members of this committee, for allowing me to testify. Mental health care for children and adolescents is especially hard to access, with a recent study finding 98.9% of pediatric hospital emergency departments reported that they boarded patients awaiting inpatient psychiatric care. That means the young person received little to no psychiatric care for hours, sometimes days, or even weeks. In that time, the patient's condition can deteriorate even more. A child stuck in an emergency room when they are desperately in need of psychiatric care is a tragedy in itself. In addition, that room and the professionals dedicated to that patient cannot serve other patients who present to the emergency department with broken bones, respiratory distress, or chest pain. So this bill will not only help mental health patients, our littlest mental health patients, get the care they need in the most appropriate setting, but will also improve our ability to care for other Minnesotans with emergency health concerns. So I thank you guys for taking up this great work, and I ask that you please pass House File 1198.
Thank you so much, and thanks for your work. Anybody else? Not seeing anyone, so we're going to move to member questions and comments. We've got Representative Hicks to start.
Thank you, Chair. Thank you again, Rep. Hanson, for bringing this bill. You know how very passionate I am about this area. I do want to speak to the really, really important work around CPS calls when a child is in the emergency room. It's not just Sue who gets those calls of parents. I have had those calls as an advocate, but also as a parent in our community who's seen as somebody who understands the system. So parents call me when they're stuck. I spoke to a mom not that long ago who said, Kim, he tried to stab me. He's not regulated, but they say his behaviors are too intense for the mental health ward because he has fetal alcohol spectrum disorder. But if I bring him home, one of us is going to get hurt. What do I do? And I say, you refuse to take him home. And on the phone, she cries. They said they're going to call the county and they're going to file abandonment. And I say, yep, they are. And we'll have to roll the dice. And I'll support you while you're working through that. And I'll connect you to the right resources, like Sue. And I'll get you those numbers. But for tonight, you need to tell them you can't take him. You have to stand your ground because you may not survive if you bring him home. That happens. And it happens every day. And we put parents who are trying their best, who have every social worker and every service, and they have tried everything they can to get the help they need for their kids. But the system's not working as it is, and Rep. Hanson's bill works to fix a lot of those other things. But this particular provision is so important to make sure that families can say, I can't do this, I need help, and not feel like they're going to lose their child or lose their job. Because the other piece of this that we haven't talked about is that when those abandonment claims are filed, if that person works in healthcare, works in childcare, works in a lot of the other fields that are under the jurisdiction of this committee, they also aren't going to pass their next net study for their job. So this is so important, it's so vital, and I just want to thank Sue, you for all your work you've done about this, and Jess, all of your work with this too. We have to make sure that parents can say, I can't do this, I need help, and not feel like their entire world is going to be destroyed. Thank you.
Thank you, Representative Zalesnikar.
Thank you, Chair, and I can't see the rep. Well, anyway, thank you, Representative. This is kind of near and dear to my heart because I'm helping a family right now who's going through this, and it saddens me to see that a child can go to the emergency room, and I understand the emergency rooms are full because I've been in healthcare for the last 30 years, and they have no discharge plan for any age. Many times. So I understand that, but to the point that this bill is talking about, it is happening. I'm dealing with it right now, and the mother has the choice being told to plead guilty to child abandonment, and she simply said, it's not safe to bring this child home. What if he hurts or kills another child because he needs help? I want him to get help. I thought that's what I was supposed to do as a parent. And, you know, it made me cry because I didn't even have any idea how to give advice except to say this is not the answer. There's no place to put these kids. There are kids in emergency rooms that haven't seen the day of light for a year. It is the same situation that's happening with nursing homes where if you don't take the hospital return, they're just discharging them and showing up with the ambulance, and the facility doesn't have any ability to meet their needs. So the problem is there, it's real, and we need to have mental health and the psychiatric services in the appropriate place for the young, the adults, and the old in a more meaningful way than this. Because right now, parents are getting charged and being asked to plead guilty in a very difficult scenario at really just trying to get access to services. So I just want to tell you, thank you for bringing the bill forward and awareness, because it is an issue in every county right now in Minnesota. So thank you.
Thank you, Vice Chair Keeler.
Thank you, Chair. Thank you, Representative Hanson, for doing this work. As we talk about the increase of mental health, and not only the increase of individuals with mental health needs and supports, the severity of it. I need to ask some clarifying questions to make sure I understand this CPS reporting piece of it and how it interfaces with our entire system. So if a parent or adult says that they can't provide the safety supports to their child and they're in an emergency room, they get a file with CPS. Do you know how many children are actually being removed from their homes and placed into some sort of foster care because of this? Or is it just a complaint that's filed that they go to court? Like, I'm trying to figure out. So we're not letting them go home and parents are saying, we love them, we just can't provide them the services that they need. But then are they actually being like taken from their parents and placed somewhere else? Because I know in my community, the area that they end up going is the juvenile detention center because of the confinement opportunities that they have there. I believe, and I'm sure many of us believe, that is not the place that they need to be. So I guess back to the question is, are children, or do we know how many children in Minnesota are being removed from their parental rights because of this issue in the emergency rooms?
Ms. Abdul.
Thank you, Mr. Chairman, Representative. So I don't have any exact data, but I can tell you the families that I've worked with, what's happened is that they just got to stay in the emergency room longer. And because there is no place for these children to go. And if they're too young, they're not going to end up in, the juvenile justice system, although that does happen with some of the teenagers. And so it's kind of like saying, it's a year of magical thinking, right? So if we refer this child to child protection, they're going to have this magic wand, right, and be able to find the service that the child needs, but it doesn't exist. And so they just get to stay in the ER longer.
Vice Chair Keeler.
I mean, the magic wand seems to be more harmful, as we've seen, so I agree we need to do this. My other statement is more for individuals who listen as we talk about mental health, because especially with our kids, I think the message needs to be really clear that in Minnesota, we see you, we love you, we value you. But also keeping in mind that when we talk about mental health, there's always an element of suicide with that, and noting that 988 is the suicide hotline, making sure that when we have these conversations, we also share those resources as well. Thank you.
Thank you, Vice Chair Keeler. Any other members? Representative Hudson.
Thank you, Mr. Chair. I'll keep it quick. A lot of things that needed to be said have been said. I'll just ask a question about Section 2, lines 222 through 227 that talks about minors under the age of 16 or 16 or older who may give consent for non-residential services. I'm assuming that the intent there is you got a minor who's in need of services and doesn't have anybody to advocate for them being able to consent, or is the idea that there's a parent who's not supportive of those services and the child wants them anyway, or both? Or can you just expound upon the intention there?
And I just, before you answer, and I'll let you answer though, Representative Hudson, I'll note that's a section that is not really in our jurisdiction, but we'll because it has to do with health or either be in health or human services finance. But let's go for it as long as you. I'm sure folks will be interested. Representative Hanson.
Thank you. The answer is there's a lot of situations. So both youth can consent to hospital and residential treatment. So why not this too? That's the short answer.
Yeah. Okay. Anything else? So we're going to go to Lee Daniels.
I might sound like a broken record at this point, but good discussion. I appreciate Representative Hanson's bill. I really have nothing further to add to what's already been said. It's been a robust conversation.
Actually, I think you're possibly going to yield your time to one of the members by the town of the table, Representative Davis.
Thank you, Mr. Chair. I apologize, Lee Daniels. I just, and I want everybody to remember with this question, I'm new here, Mr. Chair, and I'm still trying to figure out how everything works.
Yeah.
But this bill here, I would sure hate to see politics play into it. And I would just hope Representative Hanson, this bill could be a standalone bill. If that's possible, Mr. Chair, too, I would just request that to this committee, to the majority party, that you would fight to have this be a standalone bill. Thank you.
I suspect Representative Hanson would have no objection to that at all. Representative Davis, let's turn to the bill author for any final words, which can include cheering on getting this into law as quickly as possible. Representative Hanson, please.
It's almost like this committee knows that I love presenting good bills on the House floor, right? So I agree with you. We need to make sure it's moving through the Senate. We obviously have agreements between bodies before we can get there, but I would really appreciate, both parties talking to leadership about that and advocating with me on that. In the last committee, we had a lot of letters of support. We have some here, not as many, but the Minnesota Nurses Association, I've got teachers, school psychologists, the social workers, so many people behind this in addition to the Mental Health Legislative Network. So you're right. This is definitely a nonpartisan issue because doing the right things for our kids and making sure they all have a great start is something we can all agree on. And with that, I will turn it back to the chair.
Thank you so much. Boy, many thanks to you and to Ms. Abder-Holden for your work on this in this area. It's such a complicated area and it's so important. So thank you. And with that, Representative Hanson renews her motion that House File 1198 as amended be re-referred to the Committee on Human Services Finance. All in favor of that motion, please say aye. Aye. Any opposed? Okay. And congratulations and thank you, Representative Hanson. And again, I think there's great support for advancing this and all kinds of good bills, absolutely on getting into law as quickly as possible, Representative Davis. So thank you for raising that. With that, Representative Hanson has her next bill on House File 1820, which she moves to bring before the committee. And Representative Hanson, looks like you've got an A2 amendment to this bill.
Yes, Chair, I have an A2 amendment just to get the bill in the shape that I would like to present it in.
Okay, and so that's the A2 amendment, and it just looks like just a tweak that members can see in the A2. Any questions or discussions on that motion? Seeing none, all in favor of approval of the A2 amendment, please say aye. Aye. Any opposed? Okay, that motion passes. The A2 amendment is adopted. And House File 1820, Representative Hanson.
Thank you, Chair, and thank you again, committee members. Great to be back. House File 1820 is a very straightforward and pretty simple bill, but I'm going to do a quick overview of the office that this references for folks who weren't here last year or if you need a refresher. So last session, we passed House File 3845, which created an office for a youth foster ombudsperson and a board to ensure that kids in foster care in Minnesota always have someone in their corner to support their needs. The office was developed with youth in foster care by my side. The office will provide oversight for the systems that are tasked with protecting Minnesota's children from harm and will track issues affecting young people in Minnesota who interact with our foster care system. There are currently no organizations or entities that track complaints or common concerns that arise for youth in foster care. And without this data, we are left in a very critical, we're left without a very critical tool to fully address the changes needed in our existing structures. This was a bipartisan bill and it passed off the floor with a very green board, and it created the organizational structure that will create positive change and allow for the capacity to do independent investigations and track areas where this intervention is needed. So this particular bill this year changes the office of a youth foster ombudsperson from serving at the pleasure of the governor to a position that cannot be removed without just cause. This will promote the sustainability of this office and ensure that they can perform their duties without the fear of political influence. The goal was always to have this office set up this way, but I learned a little bit later than needed that the language serves at the pleasure of the governor was in conflict with the just cause piece of it. And so some ombudspersons in Minnesota are set up to serve at the pleasure and others are set up to be restricted to removal without just cause. And so these are just two common models that we can choose from when setting up an office like this. And so we feel that the without just cause is more appropriate given the goals of this initiative. And then the last part of the bill that is changed, it seeks to just extend the funds that were originally allocated for this office for an additional year. This particular language is an ongoing conversation with our fiscal experts in the House and MMB as well. And the office is not yet in place. And so there are plans for it to be up and running very, very soon, but we just want to be sure and be fiscally responsible and make sure the money that was allocated for the setup of the office doesn't cancel back to the general fund before the office is set up. And so again, we're in conversation with fiscal staff and MMB. And so in the interest of time, I don't have a testifier, but I do have experts here who can answer questions if we need it. But I will turn it back over to you, Chair.
Thank you, Representative Hanson, and thanks for your work on this issue. Any member of the public who wishes to testify on the bill, first of all? So not seeing anybody. Are there questions or discussions regarding, points of discussion regarding the bill? And I maybe will just confirm, partly for my own, for myself, that the bill is being laid over because there is still an open question about fiscal issues. And maybe direct this to Mr. Berg. If you can just remind me, Mr. Berg, as to sort of where things stand.
Mr. Chair, yes. To get into more detail, technical detail than members want, the budget rules require that if you carry forward an appropriation that would otherwise cancel, you're spending new money. So this, assuming this 775 doesn't get spent before June 30th, it would cancel. As of now, the ombudsperson has not been appointed, and so none of the money has been spent. The MMB and the governor's office say the person probably will be appointed before the end of the year, so some money will be spent. I've been doing some negotiating with MMB. They think I just today heard they think a safe thing to do would be to cancel $100,000. This is how you get around the new spending. We cancel $100,000 of the prior appropriation, creating a savings, and then we reappropriate it in the next year. They net to zero. So you would effectively carry forward $100,000, but it doesn't become a new cost.
I hate to hear the technical version of that, Mr. Berg. Simple as. Exactly right. Exactly right. Yes. No, we're very, very lucky to have Mr. Berg and the other folks in that corner. So that's why we're laying it over, because I think originally the plan was simply to move it on. And to Representative Davis's point, we've got a good bill, but we've got a bit of a fiscal issue there. Anyway, so anything from anybody else? And so. Lee Daniels, you can waive your comment if you wish, sir.
I have a really good one. I'm so glad we've got fiscal staff here, a nonpartisan staff.
Yes.
Because I didn't understand the procedure on that, but they do, and that's what makes this place go.
That's the important thing.
And this, for the first time in a long time, is a simple bill. We always start our speeches like that, right? It's a really simple bill. Well, a lot of them are, but this is really simple. Good job.
So Representative Hanson, you'll need to use that quote. This is, in fact, a simple bill. Representative Hanson, final word from you.
Nope, that's all. I did this last year, but I just want to say thank you again to everybody who voted for this office last year. We're really excited to get this up and going. Leading the nation in this way is really meaningful, and just appreciate the support. Thanks.
Thank you so much, and again, thanks for your work on this issue. I know we'll be very excited to get that person in place. So, members, the chair lays over House File 1820 as amended for possible inclusion in a budget bill or a possible showing back up, depending on what we figure out. And Vice Chair Keeler, you have House File 1858. And so you, I believe, are moving that for re-referral to the Committee on Health, Finance, and Policy. Is that correct?
That is correct, Mr. Chair.
Okay, and no amendments that I see. And so please, and I should say I have some history with the Safe Harbor work, and I'm so delighted to see your testifiers, and this is just good stuff. So please proceed with presenting your bill.
Thank you, Mr. Chair and members. So I can't say this is a simple bill or a non-complicated bill. It is pretty straightforward. We will say that. One of the things in Minnesota that we want to be able to talk about and have honest conversations about is the fact that we have youth in this state that are being sold or in exchange for sex. Human trafficking, sex trafficking is happening right here in Minnesota. We know that in the education systems, they started asking questions on the MCAs to 9th and 11th graders around sex trafficking. And we have the data that shows the percentages of how many people said yes. Over 5,000 Minnesotans in grade 9 and 11 said yes. That's 5,000 too many, in my opinion. We also know that the highest percentage of yes is in Northwest Minnesota. So I think often we think that this is only happening in Minneapolis, St. Paul. This is only around large cities and communities. The truth is this is also happening at high rates in greater rural Minnesota. I think for the safety or for time, I'll just pass it over to my testifiers from here, Chair.
That sounds good. Ms. Holger, so glad to have you here. Please identify yourself, share your pronouns if you're comfortable, and please proceed.
Thank you so much, Chair and members of the committee. My name is Beth Holger, she, her. I am the CEO for The Link, which is a youth and adult-led nonprofit with a continuum of services, shelter, and housing for youth and young families experiencing homelessness who have been victims of sex trafficking or involved in the juvenile justice or child welfare systems. We are based in North Minneapolis, however, we serve victims of sex trafficking from all over our state, from the inner city, suburbs, rural areas, and tribal communities because sex trafficking is happening in all of those communities. I'm also here representing the wider statewide coalition of the Youth Services Network. I wanted to sincerely thank all of you for providing time on your agenda to hear House File 1858. I also greatly appreciate our chief author, Representative Keeler, so much, and Chair Pinto, you and many other members of the committee for your strong support of safe harbor and youth survivors of sex trafficking. It goes without saying that Minnesota's children should not be bought and sold for sex for some predators to profit. But that's what's happening day in, day night. You know, every day, 365. We see it every day at the Link, and night, and weekends, holidays. Unfortunately, the trafficking starts young. The average age of entry is 12 to 14. I know that's another hard statistic to realize. And Representative Keeler spoke very greatly to the numbers that we have within our state, so I won't cover that. I wanted to say that there is hope, though. We have an opportunity here in our state. You all have been gracious in supporting the Safe Harbor law being passed and some great investments in this law, which we appreciate. But our trafficked youth in our state need more in order to help them heal and to help prevent and reduce trafficking from happening. We are asking for an additional investment of $20 million per year into the Safe Harbor network for additional services, outreach, prevention, regional navigators, shelter, and housing so that we can help sex trafficking victims escape the horrors that they're experiencing, get into safety, healing, and most of all, accomplish the amazing goals that they have for themselves. Obviously, these youth, I could go on and on, but I have a few other testifiers here that will speak much better than I will. But these youth are so worthy of our state's investment in dollars. And I want you to know that if you are a numbers person, I want to also give you that perspective. We had an amazing researcher, Dr. Lauren Martin, who did an investment study, a cost-benefit analysis from the University of Minnesota in 2012, and found that there is a $34 return on investment for every dollar invested in providing safety, services, shelter, and housing for trafficked youth. I also know that this works personally because I get the high honor of working with these amazing young people every day. And I get to see firsthand the amazing things that they can do once they're in a safe place, once people believe in them, and they have amazing, amazing goals for themselves. So I just am asking you to please invest some of the surplus into their safety and their futures. Please pass House File 1858 and help support trafficked youth in our state. Thank you.
Thank you so much. Thanks for the testimony and thanks for your really important work. We've got Bailey Martinez next and then Melanie Young. So once you get settled in, please identify yourself, share your pronouns if you're comfortable, and proceed.
Hello, my name is Bailey Martinez and I'm here to represent the youth. I myself am a victim. When I was 15, I was sexually exploited. I have a friend, her name was Jordan. She'd come home from school. Her mom would be passed out on drugs and alcohol, and awaiting for her was her mother's boyfriend. Jordan was later placed in foster care where she was brutally murdered in a bathtub. The Link has helped provide me services. It housed me for 9 months where I had warm-cooked meals, I had a safe bed, I had a warm shower. And with the resources of the Link, I have been able to better myself and to further my education, and I've had support as a parent. So thank you
Thank you for being here, and thanks for sharing your experience, and for it's really helpful to us. Thank you. Thank you. We've got Melanie Young up next. Please,
Thank you, Chair, and the members of the committee. My name is Melanie Young, and I wouldn't say that I was a sex traffic victim, but I was molested by both my sister and brother for at least 8 years. But I want to say that when I came to the link and when I found the link, I want to say that they helped me mentally and also emotionally, because I would take my anger out on other people. So therefore, they helped me get better myself mentally and also helped me mature a lot. And like Bailey said, they gave me a safe place to stay. They had strict rules, but they had their reasons, you know. So therefore, now that I am older, I cannot get mad at them for having those rules, because now I understand, especially now that I work for them and I get to see the different point of view. I totally understand why they did what they did and why they helped the way they helped, because it's not a good thing to go through mentally nor physically. But also okay, I'm very nervous right now.
Yeah, no,
Not
no,
like-
you were doing great. You were doing absolutely great. Yeah.
I feel like that you guys should, support us, because not only are we doing this for the youth, we want to help the parents too, because who's not to say that that parent has not been through things in their childhood life that now that they are traumatically hurt from it. So therefore, we also want to help the parents as well, because the youth matters, but the parent also matters too.
Yeah.
And another thing with the mental health, that's also a very big, major thing. So, yeah.
Thank you. Thank you so much for being with us. And I want to say to you and to Bailey Martinez too, I know it's not an easy thing to share personal things in this setting, and I know that you're doing this. I think we're all grateful to you doing this for the sake of other people, right? To make sure that other young people, and as you say, families too, are being supported, and that's just so powerful. So we're really grateful to you for being here and for sharing your experiences.
Yeah,
and to
thank
both
you
of you.
for having me here.
Yeah, thank you so much. Well, and you're welcome to come back anytime, by the way. This belongs to you. So this place is, and we're here working for you. So, yeah, thank you. Is there anybody else in the public who wishes to testify, first of all? And before we get to member comments or questions, if you'll indulge the chair for a second, I was for several years the director of training and protocol development for the Safe Harbor system. So connected to this, I was training thousands of police officers statewide. I'm working on the protocol guidelines that are in use. This was a very important part of my work for a couple years, going back a little ways now. And so I had the honor to get to work with Ms. Holger and with the Link and the incredible work they do. And so this is personal to me. And so I'm really grateful to my vice chair, to our vice chair, Vice Chair Keeler, for leading on this. So it's really good. Grateful to you. So member questions, discussion. We've got Representative Lesnikar up first.
Thank you, Chair Pinto and Representative Keeler, and thank you to the testifiers. It's disheartening to think of that Minnesota, I think, is 5th in sex trafficking, and for anybody to have to go through this. My question is just if you could explain the process and how, because I know there's certain regions, and it's not all just metro. I think the Duluth northeastern side has got high numbers for this, as well as what Representative Keeler accounted for on the western part of the state. How do we determine how funds are allocated to serve the state? Because this is a statewide issue, and there's certain regions that have, from my understanding when I've been at other presentations, high numbers. So I'd just like to hear your thoughts on that.
Ms. Holger.
Thank you so much, member, for your question. I really appreciate it. What I will say from my understanding, sorry.
No, let's get the,
thanks. I apologize. From my understanding, what we've advocated for with the Safe Harbor funds is that they really be allocated out statewide. So to tribal communities, to suburban communities to inner city communities and rural areas. And our state partners from Department of Human Services and Minnesota Department of Health have done a really good job of making sure that the safe harbor funds are allocated statewide and aren't just concentrated, in the inner city for sure, because it is a statewide issue.
Representative Zliznikar.
Thank you for the follow-up question. I have no further questions. Thank you.
Thank you so much. Representative Coulter.
Excuse me. Thank you, Mr. Chair. And to begin with, I just want to express my gratitude for all of you doing this work and continuing to move this conversation forward. I think we're always kind of learning the extent of this issue and the work that's involved in addressing it. So I want to thank you for that. And I also, Ms. Young, you made a comment, and I don't know if you intended to phrase it this way. It didn't sound like you did, but it to me was a really good way of explaining it, because it sounded like you meant to say by supporting this bill, but you said by supporting us. And I mean, I think that's really the way we should be thinking about it, that we're supporting all of you. We're supporting kids. And I'm going to try not to get too emotional here, but I mean, that's kind of why we're all in the room. So I just want to thank you for that. I also wanted to elevate the fact that one of the letters of support for this bill comes from Oasis for Youth, which is located in my district. And I've had the great fortune of working with them on a number of things and know how wonderful they are. And so just really, really grateful to be here and support this work moving forward. Thank you.
Thank you, Representative Coulter. Representative Perez-Vega.
Thank you, Chair Pinto, and thank you to Representative Keeler. I just want to add additional glow and light in so many spaces of darkness, but that y'all are the light of changing cycle. Your testimony attributes that and contributes to breaking these cycles of trauma that hit our community, that in too many ways, in too many spaces, whether it's over here in the cities or greater Minnesota, it's everywhere, it's global. And I just want to give you your ranks and warriors and being champions and advocates for this movement, because we don't need this to happen anymore, and it can't be repetitive. And I want to highlight the fact that you spoke, Ms. Young, about helping the parents, because too many returns of hurricane cycles when it comes to this type of abuse and sex trafficking that hits our communities. But you are a champion, and you are a champion as well, Ms. Martinez, in giving this testimony in a space that can be very uncomfortable. And no one's telling you to be comfortable in these spaces or with those challenges. But I'll assure you that there's a bright future, because y'all bring that light in these dark spaces. And this is what we need to be funding at the state level. These aren't patchworks. These are ways to bringing infrastructure into healing and to curing this. Thank you.
Thank you, Representative Perez-Vega. Looking to see Representative Hudson. Oh, yeah, Representative Hudson.
Thank you, Mr. Chair. And you might actually be the best person to answer this question, given your personal experience with the program. I was just wondering how people who need these services are connected with them, because I imagine, you're going through a situation that's highly sensitive, and there's a lot of social forces involved. How are people getting over that and actually getting connected with the process?
And I might have been possibly able to answer that question somewhat a bunch of years ago, but the best person to answer, I think, is going to be Ms. Holger. So, Ms. Holger, please.
Thank you, Chair. Thank you, member, for that question. It's a great question. We fortunately have a number of different ways that they're connected with us. One is street outreach. So oftentimes trafficking victims aren't identifying themselves as, hey, I'm a victim of human trafficking. So we go out, we find out from the young people where trafficking happens, because it happens, the locations change a lot. So they let us know. We make sure our outreach teams are out there. We also have a 24/7 regional Safe Harbor Regional Navigator crisis line where young people can call. And so we advertise that number in a lot of different ways, get that out there. There's a Youth Services Network app. There's an app for everything. And it actually lists our services on there for trafficked youth, and so they can know if there's a bed available, so you can check that app. We also have a lot of youth referred to us also from concerned friends, from their siblings, family members, child protection social workers, law enforcement, FBI, BCA, everywhere. Libraries, schools, yes.
You know, actually, and maybe I will correct what I said before. I'll draw out a little bit of my expertise. If you looked on the very last paragraph of the bill, Representative Hudson and all, there's funding for those regional navigators that Ms. Holger referenced. And so there's this system throughout the state of these regional navigators. The idea being there be no wrong door for somebody who's experienced exploitation, that they can be directed to service and support. I'll also note that there was first ever state funding to investigate sex trafficking, sexual exploitation, and I'm really proud. I got that my first term in the minority back in 2015 now, and that's really expanded. And those investigative task forces, those folks at the BCA and other places then work with the navigators, and I know they work closely with Ms. Holger and the link, and so making all those connections. Just provide a little more context to this issue. So anything further? Nothing? Okay, Representative Davis.
Thank you, Mr. Chair. Thank you, Representative Keeler, for bringing forth this bill. One of my questions I think I'm going to talk to you personally about actually after committee, but I would just like to take the time to acknowledge and say hats off to our testifiers. You showed a lot of courage tonight, and I honor you. My hat's off to you. Thank you so much for testifying on this subject, because this subject does affect all of Minnesota. And I look at this fiscal data and I go, whoa, that's a lot of money. And I sure as heck, one day in Minnesota, we won't have to spend money on this problem because we fixed this problem right here of sex trafficking. This is very real slavery going on in our state. And I really hope that one day we won't have to spend any money on this because we solved the problem. But today is not that day, that is for sure. So again, thank you so much, Representative Keeler, and hats off to all you testifiers.
Thank you. I know the rest of us join in those words for those testifiers. Looking to see Representative Hanson. Looks like, yeah.
Thank you, Chair, and thank you, Representative Keeler, for bringing this forward. My comments just for the testifiers and all of the youth who are benefiting from Youth Prize, or from Youth Link, from this bill and all this work. Just as a fellow survivor, I'm really proud of you, and I just want you guys to know that. Good job.
Thank you, Representative Hanson. Lee Daniels, going to you for the last word, if you have anything you want to add.
Just echoing the sentiments from before, thank you to the two testifiers, Ms. Martinez and Ms. Young. Very brave of you to come to committee in a public setting and share your story. I think it's really important to do that, so I appreciate that. Thank you for that. I'm happy to say this kind of thing started in a bipartisan way. Probably you and I started, Chair Pinto, about that time.
Representative Miller was a big part of it. Tim Miller.
Yep.
Yeah.
And we had the approval of the support of the House, which was GOP majority, and then the Senate in 16. I think they were supportive of it, and it went to a Democratic governor, and he signed off on it, and that was really great. Nice to see that. I was going to say, went right on my brain. Sorry.
No problem.
But there was some other legislation that was passed after that, and it was to do with training hotel personnel to identify that, to find out what this looks like. And I can't remember who the author was. But
And that was training, Lee Daniels, I'll tell you, that was based on training that we initiated in Ramsey County. I did the very first training of that in Ramsey County, and then it ended up becoming statewide. So, yeah.
So, I think we're going in the right direction, but like Representative Davis said, we are not there yet. So I think this money will be well used, and I resonate what he said, Representative Davis. Hopefully one day we want to talk about this.
Thank you, Lee Daniels. And before I send it to Vice Chair Keeler, just a process point. The last two sections of the bill or subdivisions would be funded from the Department of Health, which is why we're sending it to that committee. But the rest is out of Human Services, and so could be funded in our budget regardless of what happens in health, just so we're kind of clarifying that. Vice Chair Keeler, last word to you.
Thank you, Chair and members. It's definitely not about me. It's about the testifiers. And I wanted to take a minute to put them back up here because I think visually this is what courage looks like. This is a really hard space for many of us to step into and share our personal stories. And if you want to know if this investment works, the fact that they have the strength to be here to share this story with all of you proves that this works, proves that supports matter, and that we can get our youth into really powerful spaces. So please use this as the example of what happens when we see the pain in our communities and we show up to support them. They show up in really powerful ways. This is the future of Minnesota, and I appreciate all of your support. Thank you.
Thank you, Vice Chair Keeler. Thanks for your work. So with that, Vice Chair Keeler renews her motion that House File 1858 be re-referred to the Committee on Health, Finance, and Policy. All in favor, please say aye. Aye. Any opposed? Okay, the motion passes. The bill is on its way. And thanks so much to all the testifiers and to all who are doing this really important work. We appreciate it. Vice Chair, Representative, so Vice Chair Keeler is on her way back up, and Representative Kotyza-Witthuhn is on her way to the testifier table. And she moves House File 1815 to be brought before the committee. Let you get settled in, no problem. And I think whenever you're ready, Representative Kotyza-Witthuhn, you can begin presenting your bill.
Thank you, Mr. Chair. I would move House File 1815 to be before the committee. Members, Mr. Chair and Representative Daniels may remember this bill from last biennium. House File 1815 is a $500,000 appropriation to the Family Partnership to expand and integrate their executive functioning curriculum to 10 sites across Minnesota. This curriculum uses a two-generation approach to help children ages 3 through 5 and families who have multiple adverse childhood experiences or have experienced trauma. The sites include rural, suburban, and urban early education settings, including for care providers like Head Start and preschool, home visiting programs, ECFE, and parenting groups in high-risk communities. The Family Partnership will report by December 15th of this year and then again on December 15th of 2024 on progress. With me tonight are Diane Halsey and John Till from the Family Partnership to describe this programming, and I'm excited for you to hear straight from them.
Great, thank you so much. And Ms. Halsey, welcome, and please identify yourself and proceed.
Good evening, Chair Pinto and committee members. Thank you for the opportunity today. And thank you, Representative, for authoring this bill. My name is Diane Halsey. As has been said, I'm President and CEO of the Family Partnership, and I am here today to testify in strong support of House File 1815. First, I want to introduce the Family Partnership. Our mission is to close achievement gaps and opportunity gaps for Minnesota children and families living in poverty, and that is one of the reasons why I'm really excited about this opportunity tonight. We use an evidence-based, targeted approach to connect families to culturally responsive services such as mental health counseling, caregiver education, and early childhood care. Our advocacy work aligns with our policy agenda of addressing systemic disparities and supporting families using a multi-generational whole family approach. Of the families we work with, 95% live below 200% of the federal poverty line, and 90% are families of color. The Executive Functioning Across Generations curriculum launched successful pilots at the Family Partnership, at Children's Wisconsin, Children's Home Society of Nebraska, Children and Families First of Delaware, and Head Start Centers of Family Service of San Antonio, Texas, and is now being implemented in 2 additional sites in Minnesota, Headway, which is now called Uable Emotional Health, and Stearns County. The curriculum has garnered significant demand for the opportunity to participate from a range of child care settings, including home visiting programs in Minneapolis and St. Cloud, and metro area organizations that support children and families. ECFE, or Early Childhood Family Education, has also expressed interest in the curriculum and has invited us to present at its statewide conference in April. We cannot deny the adverse impact that the isolation and constant stress the COVID-19 pandemic has had on our youngest learners and their parents. We desperately need interventions like this to support young children's cognitive and emotional development and support positive, responsive parenting. This curriculum equips children with tools to develop language that describes their feelings and experiences rather than acting out on impulse. When children are empowered with this language, they learn to ask for help, talk about their emotions, and better understand their experiences. This is particularly important for children and parents living in high-stress environments. And with this funding, we can implement the curriculum into early childhood care settings throughout the state and help prepare future generations for success in school and beyond. So thank you, Chair Pinto, this evening for hearing this, and for the rest of the committee. I look forward to our continued work together.
Thank you so much, and thanks for being here, and thanks for your important work. John Till is the other testifier who signed up, and please identify yourself once you get settled in and proceed.
Good evening, Mr. Chair and representatives. My name is John Till, and I'm the Senior Vice President of Strategy and Innovation at the Family Partnership. Executive functioning skills, as you just heard from Diane, are developing most rapidly in ages 3 to 5, and they're what Harvard Center on the Developing Child calls core capabilities for life. And in a preschool or early education setting, the most important part of executive functioning that's building capacity is children learning how to learn. That's exactly what early education does, and executive functioning skills are central to that and to children being ready for kindergarten. What we do in those preschool settings and in programs like home visiting helps children be ready for school and then succeed in school in K through 12, build healthy relationships, make healthy choices, get a job, keep a job, and eventually parent well themselves. So they really are two-generation skills. And to put it simply, executive functioning sounds like that's a mouthful. But if you think about it as air traffic control in the brain, that's what this system does. It's about working memory, remembering why you're doing something at the moment. Why am I giving this testimony? Impulse control, being able to bite your tongue when you need to, and persistence and perseverance in getting things done. Those are the skills that children need most of all. In the spring of 2022, during our second year of pilots with Family Service of San Antonio in their Head Start centers, we saw some really important statistically significant improvements in 4 indicators of executive function skills for those 3 to 5-year-olds. And 2 of those measures had what are called large effect sizes. That means a big swing of the needle, so a very good result. Teachers, no less importantly, teachers who used the curriculum in the classroom reported that children who were nonverbal became more verbal over the course of the intervention, which is a really outstanding goal. And teachers also remarked that once they used the curriculum, they were more mindful about building vocabulary and storytelling skills with children. So basic language development and vocabulary was happening as a result of the curriculum as well. These gains really matter, especially in a world where kids have experienced a lot of uncertainty and chaos, years of pandemic. And while adverse childhood experiences are usually considered things that happen inside the home, what we know from the people who did the first adverse childhood experiences study is that they consider community chaos, violence, uncertainty to also be pile-ons that have the same impact as other kinds of ACEs. And the sad thing about that isolation and uncertainty with kids today that they've experienced at young ages is the fact that the first impact of ACEs, long before you start to see diabetes, heart disease, anxiety, and depression in adult life, is on the development of executive functioning and self-regulation skills. But the good news is that we can buffer kids against that toxic stress, and that's what our intervention is designed to do. And that has other benefits. When we build a good foundation of executive functioning skills, that sets the stage for positive and level mental health throughout life. And science actually shows that children and adults who have better executive function skills have less experience of mental illness, and if they do experience a mental illness, they're able to recover from it more easily.
And I'll ask you to wrap up if you can. I think we're pretty much at time.
So in summary, Diane Halsey and I have spent the last 6 months in a very intense national fellowship with Promise Venture Studios to prepare our intervention for statewide scaling. We're ready for this, and we look forward to presenting a report to the legislature about the impact of scaling of our early childhood intervention in urban, suburban, and rural communities. We're eager to get these tools into the hands of early educators, home visitors, parent educators, and parents.
Thank you. Thank you so much. Any member of the public wishes to testify on the bill? Not seeing any, so we're going to go to member questions or discussion. Member questions or discussion. Representative Hudson.
Thank you, Mr. Chair. Sounds like you're doing fantastic work. I want to try and understand how this piece of the puzzle, because I perceive it as a piece of a puzzle pilot program, fits into a broader vision for where we're headed as a state. It's my understanding that your organization receives roughly $10 million in annual contributions. This is a $500,000 grant to establish a pilot program. Usually when I think of a pilot program, the notion is we're testing something out, seeing if it works. But it sounds like this does work and it works fairly well. So what aspect are you piloting, and then what's the vision for next steps? I know that we typically keep discussion within the scope of the bill, but I'm trying to understand the...
No, that seems very much, I mean, the whole point of a pilot presumably is to have it possibly become more than a pilot.
Right.
So I do see your boss standing up, Mr. Till, and so maybe we want to call on her. I'm not sure. Either way, I'll let either the bill's author but I'm guessing probably somebody at the Family Partnership will, and you could, there should be an extra chair up there too if you want to be out there. But Ms. Halsey, if you want to answer that either way.
Thank you, Chair Pinto. I'll start with kind of the first part of the question in terms of how we see this in the broader Minnesota landscape. And, one of the things that we really know that our state is working hard to do is close our abysmal opportunity and achievement gaps that we have and that have been persistent over time. And start very early and very young. We really believe that this is one of those tools that could help with that. And so part of the reason why we want to broaden this pilot is to really begin to, we've tested in a couple of places, but we really want to begin to have a broader array of samples to really see, is this something that can really help close that achievement and opportunity gap here in Minnesota?
Representative Hudson.
So just to make sure I'm understanding what you're saying, it sounds like the process has worked in this, I don't know if this works as a metaphor, but it's worked in a petri dish of where you've tried it and you're trying to broaden out a larger laboratory in order to see if it works at scale. Is that a way to?
That's a really good way.
Okay.
I'm sorry,
No, that's right, yeah.
Chair Pinto. That's a really good way to put it. And you also mentioned something about our $10 million. That's basically our entire budget. We have a variety of services that we have for the community. In terms of 2 early childhood programs. We do outpatient mental health. We actually do anti-sex trafficking work. So all of that money goes to all of the programs that we serve. And right now, none of it is actually going towards this particular program that we're trying to really scale.
Representative Hudson?
Thank you.
Okay. And I'll maybe ask on that, 10 sites strikes me as being a certain size of pilot. Sometimes I guess I think of a pilot as being like people choose like one metro site and one greater Minnesota site. It's kind of at that scale. Can you just talk about the decision to have, obviously, I suppose the more sites, more variety, the better. But could you just provide insight on that? Mr. Till?
Well, we believe we're ready for this based on the work that's happened in our own preschools and in preschools and home visiting programs in 5 states. And we really want to see what will happen as organizations across our state begin using this in their preschools, home visiting programs, ECFE, so that they can learn from each other and so we can sharpen the tools that we're using and move faster. And part of that is because we know that it takes about 20 years to go from something that is a lab discovery to something that translates into a practical application that can be used in the field. In 20 years, that's a generation. We can't really wait that long anymore when we know what will make a difference in terms of brain science. We really need to bring that to the field and bring it to scale as quickly as we can.
Okay, thank you. Anybody else? Representative Hicks?
Thank you so much, Chair, and thank you so much, Vice Chair, for bringing this bill. We know that executive functioning is incredibly important for long-term success. It is how we organize our lives. It is how we figure out how to make dinner and help our kids with homework and get the laundry started and do our work that we didn't get done during the day and get to bed at a reasonable hour. And those are really hard things to learn, and they're so important to teach. And so I love this early approach to teaching those skills and not waiting till we've got adolescents and teenagers who don't know how to get dinner and their homework and their job and get to bed on time, to start working on some of, mapping those pathways in the brain so that we can have that long-term adolescent and adult success. So thank you so much. I'm super excited, and I'm crossing my fingers that one of the 10 sites is in my district. So.
Little plug there. Okay, Lee Daniels, looks like we're to you, sir.
Thank you, Chair Pinto. I had a couple of questions, but they're already answered. The only thing that maybe would like to ask, since we have Mrs. Housley there, is the 10 sites that you want to expand to. Is there any, do we know, like Representative Hicks was asking, do you know where they're going to be yet? It'd be nice to have a clue.
Mr. Till?
We want to do an open application process for this. So we'll work with our current partners, which undoubtedly are going to include the Minnesota Coalition for Targeted Home Visiting and Prenatal to 3 Coalition and others to really get the word out about this opportunity. And we want to recruit organizations that are excited and ready to go about brain science. So that's how we'll do it.
Okay. Lee Daniels?
Yeah, and I know we're getting short on, we're actually past on time, and we have 2 more bills and 4 more testifiers. So I will just leave it there, and thank you for the discussion.
Thank you, Lee Daniels. And can you remind me again, so it's in use right now in precisely which, like right now it's being used exactly where again?
Right now, it's being used at the moment in Stearns County in their home visiting program, at Ewable Emotional Health, and we're about to start a new cycle in our own preschools and in Head Start centers in San Antonio again.
San Antonio, Texas.
Yes,
right.
yes, sir.
And that's the thing that's being studied by the Center for Early Education and Development at the U. Is those 2 sites are being studied there?
The Center for Early Education and Development is our evaluation partner for all of this work.
Okay, got it. Good. Thank you. Good. So getting to Representative Kotyza-Witthuhn for closing remarks.
Thank you, Mr. Chair. And this program is doing fabulous work all across the country right now, and I'm excited to have the family partnership expand all across the state of Minnesota. So this program can empower parents with knowledge on their children's brains and self-regulation skills that benefit not just our kids, but us as parents. This helps kids learn how to learn and teaches parents to parent, and I would appreciate the committee's support. Thank you.
Thank you, Representative Kotyza-Witthuhn, and thank you to Ms. Halsey, Mr. Till, for your terrific work. Thank you for being here. So with that, the chair lays over House File 1815 for possible inclusion in the committee budget bill. And Representative Kotyza-Witthuhn is staying up where she is. House File 2066, you are moving that be brought before the committee. And you have an A1 amendment. Is that right, Representative Kotyza-Witthuhn?
Yes, Mr.
Okay.
Chair.
You wish to move that amendment?
I would move the A1 amendment just to bring some clarity to the fiscal appropriation in House File 2066.
Yeah, it looks like it just fills in the blank, says the amount of money that you're looking to spend. So members, any conversation about that amendment? Hearing none, so all in favor of the A1 amendment to House File 2066, please say aye. Aye. Any opposed? Okay, so the bill is amended as you wish. Representative Kotyza-Witthuhn, the blank has been filled in, and please proceed with your bill.
Thank you, Mr. Chair. Members, today is Hunger Day on the Hill, and much like many of you, I was grateful to have the time to chat earlier with a couple of my constituents, and one of those being my predecessor, Jennifer Loon, who is now the executive director of the Prop Food Shelf serving Eden Prairie and Chanhassen. As we discussed the growing usage of our local food shelf in Eden Prairie and in communities across Minnesota, I noted it was especially appropriate that we hear House File 2066 as well as Chair Fischer's bill from earlier tonight. As we well know, there is ongoing need for food accessibility, not only monetarily and financially, but geographically. Food deserts not only affect household settings, but outcomes in education, economics, and health. House File 2066 seeks to appropriate $4.02 million to the Greater Twin Cities United Way to advance their Full Lives initiative, which supports communities in creating a food-secure region where all residents have access to food that is culturally relevant, nutritious, and affordable. So my testifiers will speak to the program and some of the outcomes.
We will have them do that. So please, Ms. Rucci, identify yourself, share your pronouns if you're comfortable, and please proceed.
Thank you, Mr. Chair and committee members. I'm Tina Rucci, Advocacy Manager at Greater Twin Cities United Way. It's a pleasure to be here tonight to talk about House File 2066, which, as Representative Kotyza-Witthuhn mentioned, seeks funding for our Full Lives Food Security Initiative. At Greater Twin Cities United Way, our mission is to unite changemakers, advocate for social good, and develop solutions to address the challenges no one can solve alone. Last year, we touched over 500,000 lives across the 9-county metro area, funded over 100 direct service organizations, and have begun launching innovation initiatives such as Full Lives. These initiatives look at urgent gaps in our community and foster co-created solutions with the goal of transforming systems and disrupting inequities based on race, place, and income. All of United Way's work targets the 3 impact areas of educational success, economic opportunity, and household stability. We know food security is critical for success in all 3 of these areas. There are, however, neighborhoods, communities, and families in our state that lack access to culturally relevant and affordable food, which leads to disparities in health, education, and economic opportunity. Based on a pilot program tested in North Minneapolis in 2016, Full Lives will build a thriving, equitable, and resilient food system across our region by supporting local nonprofits and communities that are leveraging food innovation, including food entrepreneurship and cross-sector community and economic development. Full Lives will be funded through a public-private partnership made up of private donors, foundations, and government funding. State funding through House File 2066 will complement the private funding secured to strengthen our region's food systems, support a thriving economy, and most importantly, thriving families. Thank you again, Representative Kotyza-Witthuhn, for supporting this work, and to the committee for your time tonight. I'll be happy to answer any questions you may have after my colleague Megan provides her testimony and insight.
Thank you so much. So Megan O'Mara, come on up. Once you get settled in, please identify yourself and proceed.
Thank you. Thank you, Tina. Thank you, Mr. Chair and members. My name is Megan O'Mara, and I lead our innovation work at Greater Twin Cities United Way. The initiative Tina was speaking about, Full Lives, seeks to build a thriving and equitable food system in our region so all people, particularly families, have the physical and economic access to the food they want when they want it. That is really the definition of food security. We piloted Full Lives in North Minneapolis in 2016, and we're now building on our successes and our learnings there to scale Full Lives across the region. So just to say a little about what the North Minneapolis pilot did, or what our partnership there resulted in. Over 50,000 people were impacted. 14 new food sector businesses in the community were created, including 1 new supermarket. Over nearly 300 new food sector jobs were created, with 90% of those jobs held by community residents. And 12 acres of garden area food production, 136 community gardens were created, which brought thousands and thousands of pounds of fresh produce into the community where there was not a whole lot before. So as we expand from the pilot, we will work with multiple communities over over the next 5 years will impact hundreds of thousands of people, most of them children and families. Full Lives, we identify communities where food security insecurity is a challenge, and local organizations have already mounted a response, but they need support. And so Full Lives invests in these networks of local organizations by bringing technical assistance, strategic connections, and new relationships to the table to help them build the thriving and sustainable food systems that they want to see in their community. United Way is uniquely poised to do this work. We have, deep community connections and our trusted community partners. We bring not only technical and financial resources to the table, the things that are needed to make change, but we have the ability to convene and connect communities across the region, which ensures large-scale lasting change, which is our ultimate goal, lasting sustainable change here. And then finally, we have exemplar fiscal controls, deep experience and transparency with public funds, including compliance and reporting requirements. As Tina said, this is a public-private partnership. To date, we've raised $3.4 million in private funds for the initiative, and hope you'll pass Bill 2066 so we can all see a region where no one is food insecure and we have thriving, equitable food systems. Thank you.
Thank you so much. Any member of the public who wishes to testify on the bill? Not seeing anybody. So member questions or discussion? Vice Chair Keeler. Oh, I'm sorry. Representative Bliss.
Thank you, Mr. Chair. United Way has one of the most, I'm going to say this politely, robust fundraising networks that I've seen. I believe you're in the neighborhood of 50 million plus currently. Your CEO makes a hefty salary, $370,000+ a year. I find it difficult to spend $4 million of the taxpayer money to go to an organization that has such a fundraising reach, and that pays such a generous salary to the CEO. I guess that's my concern. We fund excuse me, nonprofits in here all the time, and a quick charity navigator search. If you see me on the phone over here, I'm kind of doing that. And the smaller ones, the ones we just had in here, they were a 10 of 10. They were a 4-star operation. I don't know. I didn't really dig into it why the Greater Twin Cities United Way was a 3-star versus 4-star. I didn't dig into it that far. I guess that's my concern. It's just a concern. We fund a lot of nonprofits, a lot of the smaller ones, and I can understand, needing the help and getting started. But I just wanted to express my concern that we're funding with taxpayer dollars an organization this large. So.
And Ms. O'Mara.
And if I can respond.
You may, yeah.
I guess what I'll say is that this work through Full Lives is really ultimately geared at sustainable systems change and statewide impact. So one of the things that we bring to the table is we're a multiplier, right? We can work with 100 organizations at once. We can create change on a larger scale than most individual or smaller nonprofits can do on their own. And I will say that the issues that we are addressing and the gaps that we're addressing, whatever you think about sort of what our CEO makes or whatever you think about our budget these are big statewide systems gaps that require public-private partnership. And that's why we're here today, because it requires more than what an individual donor can give to any one nonprofit.
Follow-up, Representative Bliss? No, okay. Other questions or comments from members? Representative Hudson.
Thank you, Mr. Chair. I'll make it quick, just as a quick follow-up to Representative Bliss's comment. And I really do hope that this is received as constructive criticism. When you say the goal is a sustainable system, that should be the goal. Absolutely. I think the concern on our side of the table is, some of us just prior to this committee meeting in this very room heard a detailed breakdown of the state economic forecast and where we think things are going, where the nonpartisan folks think things are going in the state in the coming years. And the question becomes, is this going to be sustainable? I mean, this is a one-time appropriation, $4 million. But if your organization, in order to provide a service that I think many folks in this room would regard as essential, if your operation becomes dependent upon having state funding, and then we find ourselves in a situation a few years down the road where the money just isn't there simply because of all of the funds we've decided to spend on so many things, that goal of a sustainable system won't actually be met in the long term. And so that's not something that you need to worry about, but it is something that we need to worry about. So thank you.
And if I may
Yeah, you
respond,
may.
and I should have made this clear. So these are time limited. This is the time limited initiative with exactly what you're saying in mind. 5-year initiative. The goal is to provide that sort of deep investment and assistance to communities to get them where they want to be, and then those communities are sustaining. So we're not. This is not an ongoing grant program with ongoing funding. It really is. We come in and we accelerate change through a mix of philanthropic dollars and public dollars, and then we pass that off. That sustains, or we pass it off to other partners who are already working in the community. But it's not meant to be ongoing funding.
Ms. Mayor, one thing I'm noticing is I don't think we have any sort of, it sounds like this is an ongoing initiative, something's actually happening now, but I don't know that we have materials on it. I may have missed that, but if you could please send those in follow-up. Yeah, Ms. Amira? Oh, yeah.
Is that
Yeah.
to me? Yes.
Yeah.
So the pilot that I referenced wrapped about a year ago, and then the scaling work will begin soon. So selecting new communities and working with new communities this year, that work will kick off.
I think maybe having some further background information in addition to just the bill language would be helpful, and I may have been missing. Yeah,
Yes, there's what I thought was a very helpful one-pager that was shared with me earlier on, and we can make sure that the committee gets that.
That'd be good. Yeah, that'd be good to send. I'm looking for other, Representative Hicks, I know. Yeah.
Thank you so much. Thank you so much, Chair. And thank you so much to our testifier. I did want to just say, as somebody who ran a nonprofit and got pilot money and had to try to figure out what to do when pilot money ran out, we're always planning for that in the nonprofit world. Nothing is ever guaranteed. That's part of living in the nonprofit space, right? We apply for grants, we apply for this, we ask for that, we fill out the forms, we do all the things. And then we're always planning sustainability. Everything we do is from a place of sustainability. And I think the testifier did a nice job of explaining how this, also incorporates that. But I am grateful to our nonprofit partners in the state of Minnesota who do take public dollars, blend them with their robust ability to fundraise, with their robust ability to identify the needs of their unique communities, to identify the needs of the unique organizations that they support, and create meaningful change in those communities with a cost savings to Minnesotans. And I really appreciate both the United Way's work in that space, but also so many of the other nonprofits that we've heard in this committee throughout this session, and the ones that we'll hear, I assume, as we move forward and next session as well. They are really our partners in this work and in this change work, and I appreciate them immensely, and I know our communities appreciate them immensely. So thank you for everything you do.
Thank you. Vice Chair Keeler.
Thank you, Chair. Thank you, Representative. I'm going to ask some questions, and I want to be really clear that I love feeding people. Okay? I passed a bill to do that. So my first question is, do you receive any of your funding through Hunger Solutions?
Ms. O'Meara.
No.
Vice Chair Keeler.
Why not?
Ms. O'Meara.
So in our food security work, our fundraising is mostly coming through corporate funders, private individual donors. We have funded Hunger Solutions in the past, but we do not receive. Hunger Solutions is funding mostly, as you probably know, the emergency food network, food shelves and meal programs. And what United Way is doing is not through this work, but supporting that network through our own grant funding and other investments.
Vice Chair Keeler.
Thank you. So you said you're supporting other networks, but this really feels like it's only for the greater Twin Cities. I mean, as a greater Minnesota member and as other greater Minnesota members, this happens a lot, that we fund programs that are designed to only support this area with no plan to really expand. We have United Ways across this entire state. So I'm interested to know, what is your plan with such a robust organization to make sure that what you do here is going to be feasible to greater Minnesota as well?
Ms. O'Mara.
Yep. So our Greater Twin Cities United Way, our service area is the 9 counties. So that's where we start. So in the scaling, we'll start there in the 9 county. But the plan for this initiatives and really all of our innovation work is to eventually be statewide.
Vice Chair Keeler.
I think information on that would be helpful. Thank you.
And maybe just, I think what you're hearing is, some more detail on all that will be quite helpful. Lee Daniels.
Thank you, Chair Pinto. It's getting late, and my brain's starting to shut off. And the comments made by Representative Bliss and Representative Hudson and Representative Keeler were spot on. You know, if this money's good.
Your brain is getting scrambled, Lee.
Hey, I got scars to prove it's actually scrambled inside of there.
Are you feeling okay, Lee Daniels?
The magic of nighttime hearings, Mr. Chair.
That's a good point, Representative Kotyza-Witthuhn. Yes, Lee Daniels.
And I'll be honest, and we didn't get some of the amendments until late this morning, early this afternoon. So we didn't have time to really look at that because I was busy in meetings all day like everybody else was. So when I got the $4,021,000 price tag, I was like, sticker shock again. Get used to it after a while, but I'm still in sticker shock of that kind of money going to a entity that can raise their own money, and that's a fantastic job. Does a lot of good work. So that was Representative Bliss' concern and a little bit of all of our concerns. So and this, am I correct? That's going to be laid over.
It's just being laid over. Representative Lee Daniels, correct.
Maybe there can be some discussions on this bill later. That's all I got. The hour's getting late, and my brain's shutting off. And
we're gonna keep moving. Yeah, we definitely do not want to give short shrift to the final bill. And I'll maybe note too for Ms. O'Mara that the issue about directing funds to a specific organization versus potentially a competitive grant, that kind of thing, often is I think a preference many of us have as well. Something for you to consider. And the bill's author, Representative Kotyza-Witthuhn, gets the last word.
Thank you, Mr. Chair and members, for the great discussion tonight. I appreciate our friends at United Way for being here with us and for all the work that they do. I think that when we have strong partners in the nonprofit sector that can help us bring these initiatives to the forefront and expand them, we really should do our part to support that, because they're doing incredible work that the state can't do on its own. So I think that I appreciate everyone's comments, and we'll work to get the committee more information on this program, and I appreciate the consideration.
Thank you so much, Representative Kotyza-Witthuhn, and thanks for your testifiers for their work. And with that, the chair does lay over House File 2066 as amended for possible inclusion in the budget bill. Thank you, Representative Kotyza-Witthuhn. Representative Perez-Vega, head on up. Somebody has to go last in a hearing like this, but I know that my St. Paul colleague, Representative Perez-Vega, is going to remind me of this when budget time comes and say her bill deserves special consideration.
That's right.
Because it had to go last, and her very patient testifier. So Representative Perez-Vega moves House File 1629 to bring that before the committee. There is an A1 amendment. And Representative Perez-Vega, you do wish to move that?
I do, Chairman Pinto, I do ask to move the A1 amendment.
Just a little bit of background on that. Yeah, please.
Into inclusion into the original.
Okay. Looks like it has an additional appropriation as part of it. And I think members, we're going to hear more about this as the bill is presented. But any discussion on the motion? And hearing none, all in favor of adopting the A1 amendment, please say aye. Aye. Any opposed? Okay. The motion passes. The bill is in the form you wish. Representative Perez-Vega, to your bill.
I'm here to present, Chairman and members of the committee, House File 1629, relating to education finance and expanding the Learning with Music program to early childhood educators appropriating money. I want to share with you, speaking of music and maybe waking up some of the members of this committee. Saludo, saludo, it's time to wake up. These are the traditional instruments of the Taíno people. Before iPads and before notebooks were even created, these are the tools as children that we learn and has continued over 500 years into the great state of Minnesota. The maraca is the first words that we learn as babies, which is a Taíno word, and the guiro, the instrument of vegetation and gourd of squash. We learn about fruits, we learn about sounds, we learned about textures as early children. I was that child who learned and ventured into my education introduction through the elements of my Taíno and Afro-Boricua ancestral instruments. The lessons learned from our music educators in village and music programming prepared me and many children in my community to adapt from our homes into a school environment, building the blocks that connect a love for diversity, acceptance, cultural awareness, literacy, writing, reading, mathematics, communication, and methods of emotional and mental support, all through música. It is a gift as a music educator to be able to teach and share that way of learning to thousands of Minnesotans' early-aged youth, including my mijita, who knows her ABCs and numbers through Motown melodies and learning different languages through children's songs. With this personal story is why I can connect deeply with the Learning with Music program offered at McPhail. Learning with music addresses concerns that young children experiencing economic hardships face a high probability of not being ready for school than others. Learning with music uses music as a tool to address that issue. Quality early childhood education is critical in promoting the development of our youngest learners and their future success. The Learning with Music program is an amazing program with evidence-based results demonstrating dramatic gains for our youngest learners and their school readiness skills. The Learning with Music program developed by McPhail Center for Music is unique because it trains EC childhood educators to incorporate musical activities throughout the school day at early childhood centers. Learning with Music has proven results. A longitude study was conducted on over a 3-year period, and research results show 150% greater growth in children's control. This research study has been published by the Early Childhood Research Quarterly. Active participation in music positively impacts the development of school readiness skills, setting the stage for children to be ready to learn. Learning with Music provides resources for early childhood educators who work with our youngest learners experiencing economic hardship to support school readiness preparation. The combination of integrated musical play and quality early childhood programming is powerful and could be a tool that helps us reduce the achievement gap. Let's talk about the OSP, Online School Partnership, accessible high-quality music resources for all Minnesota. This purpose of the McPhail Online Music Education Bill is to provide access to music education for students throughout Minnesota using online technologies. The program targets schools in greater Minnesota and schools who are designated as Title I schools or have a student population in which 40% or more receive free and reduced lunch. McPhail Center for Music is a highly respected institution in Minnesota with over 100 years of experience in music education. I'm grateful to be a part of that experience as once serving on the Teaching Advisory Committee in 2009. McPhail's innovative online school partnership program began in 2011, well before the COVID-19 pandemic, requiring schools to move distance learning. The OSP program is a resource for school music educators, allowing them to direct the support in areas most in need in music programming. Program emerges schools in individual lessons, group class, and sections in live interactive sessions with the McPhail teaching artists. Schools throughout the state have utilized the program no matter their geographic location. I think it's time to really take in consideration what we can do with the empowerment of music and play so that we can provide the next Prince of Minnesota and even up to Hibbing's Bob Dylan. I ask chairman and members of this committee to support HF 1629 so that our teachers in school have accessibility to provide music education and invite young kids to enter their educational journeys in diversity, focus, comprehension, participation, balance, rhythm, and most of all as a vocalist, harmony. Thank you.
Thank you so much, Rosa and Paris-Vega, and thanks for the music to kick us off. It's a great way to end have it as our last bill. Diana Babcock, I think, is our first testifier, so please identify yourself and proceed.
Good evening, Chair Pinto and members of the committee. My name is Diana Babcock. I'm the director of Sing, Play, Learn at McPhail Center for Music. And Sing, Play, Learn is our early childhood music program at McPhail. We work with ages birth through 8 years. I'm really excited to tell you about the Learning with Music program. So as you know, and this has been talked about this evening too, that quality early childhood education is a key to setting the stage for a young child's success in school and life. And those experiences that experience economic hardship are sadly forever behind. And we know that for a fact. But there is an unknown solution and a missing link, which is music. And I'm actually going to do something as well here to kind of get us going so you can experience it yourself. Could you get your pencil out or your pen? Okay. And you can sing along with me if you want. It's just a very simple phrase. But I'm going to have you tap, and when I sing stop, you're going to stop. We tap and we tap and we stop. We tap and we tap and we stop. We tap and we tap and we tap and we tap. We tap and we tap and we stop. So what happened when we said stop? You stopped, right? So we're working on impulse control, and that's just an example.
I think that's also called executive functioning, too.
That's right.
little callback there, okay.
That is right.
Yeah.
So what we're working on with the Learning with Music program is executive functioning skills, social emotional skills, cognitive and language, and things like that. So music, as you know, we're experiencing now is fun and engaging and novel. It gets your attention, so you're ready to learn. It promotes self-regulation, like we were talking about, executive functioning skills, impulse control, emotion regulation, so they're ready to learn and listen, and so much more. It also is one of the few activities that uses both sides of the brain. And that, I think, makes it so impactful in so many ways. So when music is integrated into the learning of our youngest learners, it improves their learning, obviously. And we have tested results and proven results that are pretty amazing. So that's where the Learning with Music program comes into play, with results of 150% greater gain in inhibitory control, which is impulse control. The Learning with Music program is an amazing, unique, evidence-based program for preschoolers 3 to 5 years experiencing economic hardship and their teachers and families. And when I was an early childhood teacher prior to working at McPhail. I noticed that a lot of the early childhood educators at that time and still feel uncomfortable using music. They feel they have to have an operatic voice or something like that, or be a pop singer. And so the kids don't care what they sound like, but just getting them to feel comfortable in knowing that music is important and easy to use.
And I do want to know we're going to need to be out of here, I know, strictly at 8:30. And
Okay,
we need to
I can be super quick.
Yeah, so if you wrap up real quick if you can. Thanks.
Absolutely. So the program is unique in that it trains early childhood educators how to integrate music into their daily activities throughout the day, such as adding a song and a chant like we just did, to help them to focus, to transition, to write their letters, to wash their hands, you name it, just goes on and on. And so after years of the programming, it became apparent to prove what we already knew by doing a 3-year longitudinal study. And what we came up with, again, was 150% greater gain in young children's inhibitory control, was able to learn, and then this was all through the training of early childhood educators.
And do we have another testifier going, like after you, or are you the last testifier?
We have one more. I just have
Okay.
one quick,
Because
super quick
I do need you to have you wrap up. I'm so sorry.
Okay, that's okay.
Yeah.
Sorry.
Yeah.
So House File 1629 will enable us to develop training programs and opportunities, deliver those to Greater Minnesota, all over the United States, or over the state of Minnesota, sorry, and then to expand our Learning with Music programming through direct programming. So I'd like to thank you to consider this and to help our youngest learners be ready for kindergarten.
Thank you so much.
Thank you.
Thank you. I'm going to have to ask Ms. Winslow to be pretty quick, but please identify yourself and proceed.
All right.
right. Greetings, Chair Pinto and members of the committee. I am Elizabeth Winslow, pronouns she, her, hers. And I am the Director of School Partnerships at McPhail Center for Music, which encompasses the online school partnerships. Prior to this, I was teaching in public schools. And I'm here today to share why supporting online school partnerships with McPhail through House File 1629 is crucial for today's students. We provide accessible online low-cost lessons, sectionals, and classes at a steeply discounted rate. In affluent and metro area schools, bringing in teaching artists, offering private lessons, having more than one band director is commonplace, but this is rare in Title I and greater Minnesota schools. We are disrupting this inequity by bringing our exceptionally talented and passionate faculty into classrooms to support the already incredible efforts of Minnesota's E12 teachers. This past year, through online school partnerships, we've taught everything from early childhood music in partnership with Diana's team, culturally relevant music programming that the teachers came to us asking for help and support with, electronic music and lessons. We partner with Wilder Research to review our impact every year, and I want to point out two statistics that are on the one-page document you have from us.
I'll need to have you probably just one more minute.
Oh, I can do this. 88% of students reported that we worked with supported that they felt increased motivation to do well in band or their ensemble and to do well in their instrument. And 67% reported that working with us had a positive impact on their mental health and made them more excited to come to school. So as a parent and educator, I find that kind of data powerfully compelling. Through access to high-quality online experiences with McPhail, we can help reach students who may need a reason to engage in school. And thank you for your time and support.
And thank you so much, and I'm sorry that about things being a little bit squeezed. Any members of the public who wish to testify? There's not a lot of you left, but anybody wants to come down? And so for that, comments or questions, I see Representative Coulter. We'll start with you.
Thank you, Mr. Chair. Excuse me, I will be very brief and say, first of all, that kind of feels like brushing up on executive function skills might be a good skill to have around here in a couple of different places. In particular, impulse control, I dare say. But just really want to thank you for bringing this forward. Some of you know I actually went to school to be a music teacher, and when you go to school to be a music teacher, you have to learn the whole gamut. You don't just go to school to be a band director. I am just so grateful that there are programs out there that are integrating music and play in this way, and really music and education and learning opportunities, and just really thankful that this is coming forward. Thank you.
Thank you, Representative Coulter. Other member questions, comments at all? Okay, I'm going to go to Vice Chair Keeler.
Thank you, Chair. Thank you, Representative, for bringing this forward. I love music. One of the things that I love about music is, as Indigenous people, our drum is actually the beat of our heart. And we know that, and it's extremely calming. We use it, in our tribal communities to support ADHD, those things that really we need for calming. So I love this. My question is around the Greater Minnesota outreach, and this is music. You showed us, it's actual instruments. It's online teaching. And so I'm wondering, what is the commitment? How does that work if you're partnering with schools or organizations in Greater Minnesota? Do you build something unique for them based on what they have on hand, or do you send them the instruments that they would need to be able to do something like this online?
Ms. Winslow, pardon me, yeah, please.
Thank you, Chair Pinto. So Representative Keeler, to address your question, like Representative Coulter, was a high school band director, came into this job a little skeptical. We're in the pandemic, everything's online. How are we going to create quality music opportunities for kids through the screen? They're used to screens, right? But that's kind of the magic of McPhail, is that we really tailor it to each school. And that's also what makes our department really complex, is each school that comes to us, we create a partnership specific to them, their kids, the kids they have in the room, anything that the teacher identifies that maybe as a teacher they wish they could work on, but they don't have the skills, and so we can bring in those people. We have a kind of on a side, but as part of our school partnerships, a really robust artist in residence program, global music initiative through that. And then we're integrating them into our online school partnerships program. And so it's a really robust and comprehensive and adaptable and flexible for each school.
Vice Chair Keeler. Thank you. Lee Daniels.
Thank you, Chair Pinto. I'll be extremely brief. I think we have a 8:30 deadline. I know staff here would like to go home. I'm sure the Sergeant Arms like to go home, their staff. So I'm just concerned, again, like a broken record, about the grant management that we brought up in many bills. And that concerns me. And then some of the funding going to these larger nonprofits, and I'll just leave it there. I don't want to get into that. It's too late in the night to start that conversation. So I'll leave it at that, and hopefully we can. And one question, is this going to be laid over, Chair Pinto?
You know, Lee Daniels, it's interesting you asked that because that is the plan. I do note that the amendment partners with schools, and I don't know that education and finance would sort of mind sort of either way, but one thought I'm having is that it's possible, Representative Perez-Vega, and really up to you, but it could be that if it goes to education and finance, then potentially could get funded in either of the budgets, which might just give you a double opportunity to possibly advance this. So I'm kind of wondering if we might want to actually send it to education and finance for consideration. That doesn't mean anything happens in either bill, so that would be at least something to consider. I'm sorry for not having occurred to me before. Again, I don't think there's any problem with us funding it and having them not hear it. But I also could imagine it might just give you an opportunity potentially off in the K-12, budget, and possibly be an opportunity there. So I'll let you. I don't know if you have any thoughts on that, Representative Perez-Vega. If you understand what I'm
Chairman.
saying. Yeah.
We're talking about early childhood, right? Even at an infant rate is where this great institution of music for over 100 years that has been very diverse and inclusive with so many nonprofits and artists. I know these artists personally, great diverse. If we want to teach indigenous music, we are working with the best indigenous artists in the state. If we are talking about providing curriculums for African American history and music, we are making sure that we're talking about the blues note coming from Surviving the Middle Passageway. So when we're saying skeptical about the organizations, these organizations have been vetted and are part of the Minnesota music history that shows us the beats of the drum from where they started, the first musicians on this indigenous land, into where we are in hip hop, like Carnage, who's an international beatboxer. So the eclecticness of history is the foundation of the work. So the funding, yes, hey, let's get this funded. It works. Our kids need therapy. Our kids need accessibility at an early age, and these are the opportunities. So whether we can get it in this batch of eggs or the other one, I take the lead from both chairs. So thank you.
Okay. Thank you. Lee Daniels, I think you had something else, sir?
Yes, thanks, Chair Pinto. I just was going to make a request so we can maybe lay this over, then maybe we can finish it at another committee meeting to give it a little more consideration, and when we're not 8:30 at night, 2 hour, or hour past the.
Yeah, to be clear, Lee Daniels, so either way, it's being essentially laid over in our committee because we'll have a budget bill come out, we'll consider it. I guess the question is simply, do we provide an opportunity for another committee to consider if they wish? So I guess my thinking would be that I'm inclined to vote it out. That doesn't mean, though, that it wouldn't be available for us in further conversation, because we're not making any decisions when it comes to the Children and Families Committee at this point. It's just we're simply providing as an opportunity for others. I do want to just make sure, I feel like there was a question somebody raised. We did approve the A1 amendment, as far as I recall. I can see the lead, the bill's author agreeing. So Representative Perez-Vega, I guess I'm going to suggest that you withdraw your original motion and move that House File 1629 as amended be re-referred to the Committee on Education and Finance. Are those your motions? Is that what you want to do?
Aye.
I'm going to consider that as being what Representative Perez-Vega is doing. And so with that, all in favor of House File 1629 as amended being re-referred to Education and Finance, again, not making any final decisions in our committee, but sending that on, please say aye. Aye. Any opposed? Okay. So the motion passes. The bill is on its way, but again, can come back up in our committee. Members, I would ask your help, and I think the staff will too, in really making sure that we're recycling and just doing more organization than we might otherwise to get everybody out of the room as quick as possible. Members, thank you so much. We're on again tomorrow morning. My apologies for that at 8:30, and with that, the meeting is adjourned.